Chair McKinsky, you're live.
All right, we're back from lunch break, and we have with us Department of Family Services. And we will turn it over to, you've got quite a few folks here. I'll turn it over to you. The floor is yours. Please.
Thank you, Mr. Chairman.
Corin, I went blank for a minute.
Sorry.
Corin.
I'm new here. Thank you, Mr. Chairman, Mr. Co-Chairman, members of the committee. My name is Corin Schmidt. I'm the Director of the Wyoming Department of Family Services. And with me today at the far right is Corinne Livers. I'm Corin. She's Corinne.
Okay.
She is the Senior Administrator for the Economic Security Division. To my right is Christy Gordy. She is the Senior Administrator for the Social Services Division. And to my left is Rhonda Holt. She is our Chief Financial Officer.
Okay.
We have had two changes in leadership. Christy was previously our Senior Administrator for Economic Security. She's moved into the Social Services Division role as of September. And Corinne then moved into her spot, into Christy's former spot. So familiar faces, a little bit change in role. So I thought today I would maybe hit some of the general questions that have been being asked by the body at the beginning and give a little bit of context to the agency, and then per the request, dig right into our two exception requests,
Okay.
or supplemental requests. First, in regard to turnover, we keep track of our turnover on a monthly basis. We look at the last rolling 12 months, and at this time, we are at 11.8% turnover rate, which is down from 16.4 at this time last year. So our turnover rate has decreased substantially. Our current vacancy rate is 3%. So out of about 663 positions that we have, 8 positions are vacant. Our span of control is 5.1. Why I think we have such a great vacancy rate and turnover rate is because of our supervisors. In our employee survey this year, that's where employees scored us the highest, was on their relationships and supports from their supervisors across the whole agency. So I want to thank our staff, our families out in the field and in the Cheyenne office, thanking them for the time that they give to their staff for this work.
Yes, please.
Thank you, Mr. Chairman. Director Schmidt, so with that overall population, what percentage of your total employees then are in Cheyenne, and then the rest are out providing services in the state?
Mr. Chairman, Representative Larson, about 87% of our staff provide direct services. So that means that they're out in the state. We have 28 field offices where we engage with the public every day, and then 2 youth facilities that are also providing direct services. So that leaves about 13% of our program and policy people, administration of grants, dollars, fiscal, and the basic operations of the agency. Out of our 663 positions, we have 260 intermittent telework agreements. So about 40% of our staff have intermittent telework agreements, which means it's there if they need it. We have a lot of working moms, sometimes with sick children. If they stay home, they can also intermittently telework if necessary so that they can participate in some work if their situation allows. We have 19% or 128 telework agreements, which means they're on a steady, stable schedule of part-time telework in the office sometimes, out of the office other times. And then 2% are full-time telework, which is about 14. Many of that 14 are actually doing state program policy work. They're not doing local direct service work, so it's easy for them to work from their homes because their work is basically telework anyway. So that's the overview of our agency. Of course, there's a lot more to say, but the budget book and the narrative that we provided this time last year is extensive, and I think is a good reference point if there are more questions.
Any more questions about the agency generally? Okay, proceed with your exception requests.
Okay, Mr. Chairman, thank you. We come to you with two requests. The first one can be found on page 13. A little bit about these supplemental requests. We spend a lot of time in our agency and certainly just in the general public talking about children. We talk a lot about children being safe, children being free from abuse or neglect. What we haven't talked about so much, not just in Wyoming, but on a national scale, we haven't talked a whole lot about vulnerable adults, and we haven't talked a lot about children who have aged out of care or who more or less have grown up in the system. So these two requests very much reflect the importance of these two populations, and I'll speak to more details about them specifically as we go through the request. The first one is for Adult Protective Services vulnerable adults. The legislature created a task force. It's been going for about 3 years. And it's during those conversations that this task force has really delved into the issues around vulnerable adults. Vulnerable adults are anybody at age of majority that are vulnerable due to a physical disability, a intellectual disability, or because of advanced age. We consider advanced age under the federal guidelines is 60. I'm not going to take that personally, if none of you will. However, we do have a population in Wyoming that is aging rapidly. We know the demographics are showing that as a growing population, whereas our younger people, that population is starting to shrink. And what that means is that we find adults oftentimes in positions where maybe they can't fully care for themselves, they can't fully make decisions, which puts them at risk for abuse and neglect, and especially self-neglect. The task force, which was created of the legislative branch and led by the legislative branch, members of the executive branch, including the Department of Education, the Department of Health, and the Department of Corrections, and the judicial branch through the Supreme Court administration and the chief, have had a lot of conversations with a tremendous amount of public input regarding what is the state's policy around this population. From the DFS perspective, we fully recognize that this population is tricky. These are adults, which is very different from how we engage with children. For children, we have a system, a court system, that recognizes when children need to be removed. They take legal protective custody. We then work with the children and families and foster families and wherever those children are placed to try to develop the best opportunity for those children to go home, to go back to their families. With adults, it's entirely different. Adults have the ability and the right to make decisions. The state does not take protective custody of vulnerable adults like it can with vulnerable children. So the tools in our toolbox for this particular population really rely on community engagement, community-based services, and community collaboration. And the work of the task force highlighted that in trying to understand what are the essential services these vulnerable adults need, who's responsible for providing those services, and ultimately who pays for those services. The work our agency does is really around the most vulnerable, those that for some reason have come to our attention because of an identified high risk, or even because there has been an incident of abuse, neglect, or tremendous self-neglect. So when we talk about getting engaged, we really are talking about engagement at the level where there's been a lot of community involvement, families may have tried to participate or be engaged, and for some reason, the adult continues to be vulnerable and their situation has continued to worsen. Our goal as an agency, just as it is for our children, for vulnerable adults, is for those adults to be able to live safely at home. We want them to stay home as long as possible. But what we also recognize is that staying home can be quite difficult for somebody who perhaps is aging, that's encountering maybe some slight dementia, that maybe has some risk financially, that maybe lives in a home where they can't physically care for their home anymore. So the conditions for this group of people that we serve is incredibly different from that of our child welfare population or our juvenile justice population. And I want to make that distinction because the remedies are very different as well. So through the course of the work of the last 3 years, there's been some incredible things done. We've talked about financial exploitation, worked with the banking industry and the credit unions who see financial exploitation happening with their customers, but not really having any ability to do anything about it. So this body, the legislature, passed some great legislation that gives some pause, gives the banks a little bit of an opportunity to dig in a little bit and understand what's going on before they have to refer it any further. Our goal is that communities, families, and vulnerable adults do the best that they can to take care of what they can before a high level of intervention comes with the state. However, we do recognize that in the cases we do work, that in those cases of exploitation, abuse, and neglect, the majority of the time, over 50%, that abuse and neglect is happening by a caregiver or a relative. So we're in an uncomfortable situation many times where the people who are charged for taking care of their loved ones, just like with children, aren't doing it adequately or appropriately. And then that requires some level of intervention by others, community, law enforcement, or DFS, and eventually sometimes the courts. So the budget request that comes to you is really about those very high-level emergency services. One piece of legislation that the legislature passed increased the system's ability, the courts, DFS, law enforcement, to stay engaged with a vulnerable adult, extended an emergency period of time from 72 hours to 2 weeks. Coordinating and trying to put services in place for this population is incredibly difficult, especially as you can imagine in our smaller communities where there just aren't very many resources. So it's during this 2-week period that we are actively looking for family. If there's no family that's immediately known, we'll be looking for family, we'll be looking for friends, we'll be looking for colleagues to be able to step in and help us. We'll be looking for temporary housing if the person can't stay at home safely because of the environment. Many times we find vulnerable adults living in houses that they've lived in for decades, accumulate stuff, they don't have the physical ability to move it out, and so therefore it becomes a tremendous health hazard, not just a public health hazard, I guess I can say. So the request primarily comes to you for additional dollars to help us help those families when they're in those emergency level of need. The budget is based on kind of 3 different requests. One is emergency housing. Looking at the data in our field, we see that we have vulnerable adults who need housing for about a week. This is temporary, this isn't ongoing, but this is just enough time for us to be able to, in the case of a dirty home, go in, clean it, try to move out as much of the accumulation, and then the adult can move back in. For other adults, it may be that their home environment isn't safe because of the people living in it. It's during that time then that we can have that person be somewhere safe, and then law enforcement can do what it needs to do to I guess vacate the home. I was gonna say kick them out, but I think there's probably a better word. The next funding amount, the $200,000, is for emergency services. And the emergency services are all those other things, the housekeeping, temporary food, clothing, those things that maybe we could provide on a temporary basis that would help keep that person safe at home if necessary. And that's really the ultimate goal. This isn't ongoing funding. These are dollars that we can spend locally that will help that person then either stay safe at home or give us enough time to find somewhere where they can be safe. The last set of dollars is for guardianships, and this is a little bit of a tricky space. Guardianships are ongoing services to people who have absolutely no one who will step up and help them make decisions. We believe that the role of the state is to connect these people with those services, but not to be the guardians ourselves. So we have funding, a limited amount of funding. We're requesting more funding to provide guardianship services at any given time to about 15 adults. And again, this is a last resort, but it is at that time where we have a vulnerable adult who really can maybe make some decisions, but not all decisions, and needs someone to help them navigate through their lives, their financial systems, their housing situation. Part of the money that we're requesting is the one-time legal fees that it takes to set up a guardianship. This is a court action. This is not an action that DFS can do. This is with the oversight of a judge. The judge makes the determination on the guardianship and then awards the guardianship. The guardian is then responsible for reporting to the court, I think, annually thereafter. In our state, we purchase those services from the Wyoming Guardianship Corporation. So they are a nonprofit organization that hires people, staff, to act as long-term guardians at any given time for us for about 15 people. So that is the bulk of the request for our vulnerable adults. To summarize, it's about $505,000 a year, so biannualize that, a little over $1 million. We are currently funded at $40,000 a year in general fund and about $105,000 in federal fund. So our current budget for these services is about $145,000 a year. That's for all vulnerable adults.
Can you give me those numbers again?
Sure. So we're requesting $504,996. $85,386 is for temporary housing. That's the temporary hotel stays. And $200,000 for emergency services. $55,435 for one-time legal fees. And then $164,175 for ongoing guardianship.
And what do you now get from the federal?
Currently, we receive it's on average $106,000 in federal funds and $40,000 in general fund.
Mr. Chairman, I'm somehow not adding that up. The 106 and the 40, that's per year or per person or?
Mr. Chairman, Senator Anderson, that is per year. That is the amount of money that our budget has for this population. $146,000 a year.
We're thinking we want to increase that by $700,000, $800,000?
We want to increase it annually about $500,000.
Okay. Okay, I understand.
Please.
So Director Smith, the task force that you referred to, one of the glaring things was the point that Senator Anderson just brought out, that your agency had $140,000 per year to administer the Adult Protective Services budget. And so the question then I believe that was asked is what services are they getting? The answer to that was not much. And with that growing population, then they work to identify what services were warranted and what services really had priority. And correct me or help me, but it seems like after the first year, second year, you applied and got some ARPA funds to increase the guardianships. Did that help you to understand what level of guardianship capacity we needed, and is that reflected in this request?
Mr. Chairman, Representative Larson, yes. What we learned after receiving the ARPA funds was how much unmet need we had, which was the basis of this request. So after we did the data crunching and understanding the essential services per our conversation in the task force, recognizing what it is that DFS should be responsible for in regard to the level of services we provide and the kind of services we provide, we honed in on this amount, about $500,000 a year in addition to what we already received to serve this population. That is increasing at our caseload rate has increased by 8% over the last couple of years to serve this population.
Follow up.
Please.
And then in regard to housing, again, you're not saying, you're not volunteering your agency to be the landlords of long-term housing for this population. You're saying that in an adult protective service response, somebody notifies your agency, they respond, one of the top priorities is to keep that person safe and sheltered, and that you would have the resources then to put them in temporary housing until a more permanent or long-term housing can be met. Am I saying that right?
Mr. Chairman, Representative Larson, yes.
Thank you.
Okay.
Mr. Chairman?
Senator Anderson.
Mr. Chairman, I'm back on my 146,000 federal funds. It seems that is incredibly low. Is that because we don't apply for more funds, or that the feds don't have a fund for that, or why is that so low?
Mr. Chairman, Senator Anderson, the feds really do not have a funded program for this population. It is a state responsibility. Where you do see a lot of money coming in for services, those dollars go to the Department of Health. And they provide extensive services to this population. However, Director Johansson. However, a lot of those dollars are for a larger population. We're being pretty specific here in who we're targeting for these dollars. A lot of the money that they receive goes to the senior citizen centers, or it's provided through one of their federal programs through Medicaid. Waivers, long-term care waivers, their community-based waivers, provides a lot of support to this population, and it's those services that we want to connect people to. It's just sometimes we have a right now, right here situation that requires some cash to be able to address.
Please, Senator Guru.
Thank you, Mr. Chairman. So what I'm hearing you say is that while there's funds out there, as I look at the Director of Department of Health, we're targeting here. We're targeting a population that's growing, that has a specific need, that you have identified by other funds that you received, just kind of highlighted the need. Can you talk to me a little bit about, based on what you know and based on the data crunching you have, how many people are you looking at touching? How many of our citizens are we talking about here? I mean, in just general, no, I know you don't know exactly, but I mean, just based on your number crunch.
Not very many at 146.
Mr. Chairman, Senator DeGroot, we're looking at about, at any given time, 848 vulnerable adults. However, what we're targeting in these specific cases are really around our investigative cases, which were about 114. So not an extensive population, but certainly a growing population. And as I mentioned at the beginning, we've always focused quite a bit on children, but in Wyoming, we are facing a different kind of need. I do have to say, though, that the legislature did give us 2 positions last year for adult protective services, which is how we do the bulk of our work. We do a lot of case management, connections of people to community-based services, unlike with children, where we're really trying to figure out how to get those children home. For adults, it's more community-based work through organizations locally.
Mr. Chairman.
Please.
So, Director Schmidt, I think we historically look at Department of Family Services, as you pointed out, to address the needs of children who are in need of services, protective services, and whatever that is, to keep them safe and out of harm's way. The overall population of children you serve relatively is small compared on a statewide average. This is the same concept. We have a large population of adults that the Department of Health and others have programs for, but your agency, if I'm correct, is given the responsibility for adult protective services, which is really targeted to investigate those instances where somebody well-being is being jeopardized, so that you can then keep them safe until they can get on some of these other more long-term programs. And so you've been doing that, or attempting to do that, with $100,000 federal funds and $40,000 state funds. So we've recognized that, and we're working to do that. And then I believe you're working, if you just follow up, if you and Director Johansson are working to collaborate to identify how then we can coordinate those services to provide the essential services for this population and keep them safe and out of harm's way.
Mr. Chairman, yes, that's correct.
Mr. Chairman?
Senator Anderson.
Mr. Chairman, Director, I'm really concerned about these dollars because Senator Guru and I are soon to be vulnerable adults. And we're really concerned about your funding. So we're looking into this.
Can I join?
Mr. Chairman?
Senator Guru.
And while Senator Anderson and I have a mutual agreement that we're gonna vacate our houses and have somebody come clean them up for us, we're gonna clean up each other's houses. Just a question, pull back.
Yeah.
You know, a lot of these issues come up, we've got a task force, we've identified a lot of these issues, and we've been working on this for quite a while. 10 years ago, you had 813 employees. Today, how many do you have?
Mr. Chairman, Senator Guru, we have 663.
663, down from 800. Okay, thank you, Mr. Chairman. What was it? 813.
Anything else? Okay, back to you, Corinne.
Thank you, Mr. Chairman. So moving on to our next population, and this is a program called Independent Living Program. And this is a group that we serve of older youth, ages 14 through adulthood, that have experienced time in the system. So when I say system, for Wyoming, what that means, it can mean our child welfare system, a child in need of supervision, or a juvenile delinquent that's part of juvenile justice. And this is a little bit of a philosophical issue as well as a unmet need issue. But many of these youth come into the system or grow up in the system because their families were unable to take care of them. They spend time in foster care. Most of them return home. About 72% of our cases, our kids go back to their parents or their families. But we do have a percentage that are adopted, and then we also have a percentage that just have no permanency. And what that means is that they leave the system with really no quality family adult to connect to. So this is a population that I feel deserves our attention. If government's going to get involved and remove children, then government has some level of responsibility to give those kids a shot at being good adults. What we know about kids that go through our system is that by the time they're 21, about 25% of them are parents. Only about 70% have high school degrees. A limited number go on to higher education or a certification program. They'll have increased risk of criminal behavior. But I think the one thing that's important to remember is that about a quarter of them go on to be parents by their time they're 21. That's a generational issue, and I really see the opportunity of these dollars as a prevention mechanism, giving these youth a chance at living sustainable, self-sufficient lives so that when they have families, which is going to happen, they have a better shot and their children have a better shot of being safe at home. It's an opportunity for success. We have an organization in our state called the Wyoming Youth Advisory Council, which is made up of former and current foster youth. They brought this to our attention and said, we think that the current funding that is provided, 100% federal dollars, does not meet the needs of our youth in our state. And I happen to agree. So this request is for about $500,000. It's money to go to local coordinators who provide independent living services. So the primary way that we provide independent living services is through nonprofit organizations all over the state who hire independent living coordinators who then work directly with those youth to provide them the mentoring to help them secure employment, secure housing, to get into certification programs. If they're interested in higher education, community college or higher, work with them to try to get them securely placed in any of those institutions. Also, part of the request is money for education and training. And we call those education and training vouchers. Those are funds that go directly to the institutions, the programs themselves, to offset the costs of the participation. So the current appropriation that we receive, as I mentioned, is 100% federal fund. We receive about $500,000 in what's called the Transition to Adulthood program. These are the federal dollars that pay for our current independent living coordinators in those programs. And then about $140,000 for education and training. We served about 754 kids in our system in 2023. And of those kids ages 14 on up, only 472 received services, which leaves about 270 or so who did not. This request is to expand our current services with state general funds to serve a larger number of youth and to provide educational and training opportunities for youth as well.
Please, Senator Salazar.
What is the name of this program again?
It's called, the state, Mr. Chairman, Senator, the state program is our independent living program.
Okay.
The
thanks.
federal program is called CHAFE, and it's federal legislation that provides independent living services and educational vouchers.
Thanks.
Mr. Chairman.
Senator Guru.
Thank you, Mr. Chairman. Director Schmidt, what do these, ballpark for me, what are these home living advisors, what do they get paid? What's their salary? You know? The folks that are.
Mr. Chairman, Senator DeGru, I have no idea. We will look into that and get back to you.
Please do.
Yes.
Thank you.
Mr. Chairman?
We've got somebody in the back there, Corin.
Thank you, Mr. Chairman. I'm hearing several numbers coming across regarding how many employees, how many FTEs, and how many clients have been served across the services. I would like to see at some point a ratio there, how many FTEs versus how many clients served across the various services, if I could see that sometime.
Thank you. That's doable.
Mr. Chairman, yes, that's doable. I can tell you on our social services side that per caseworker, we average about 20 families, if that gives you some context. But yes, we can dig into ratios.
Okay, and let me ask you this, does the caseload vary? I mean, maybe somebody's got some really difficult cases. Do you move their caseload down to 15 because they've got just some real rough ones, or no?
Mr. Chairman, we try to, but we're very much community-based, so we'll,
I see.
one caseload is, if
Just
there's only
maybe
3
somebody's
workers.
crossed a bear, okay,
Yes, Mr. Chairman.
gotcha.
And, Mr. Chairman, I have an answer to Senator Guru's question.
Okay,
We were told about $16 an hour. We also have a provider of independent living services here that may be able to corroborate that. Yes.
okay,
Thank you.
anyone else? Okay. That's Senator Anderson, and then Representative Walters.
Mr. Chairman, I'm looking at your handout that has the enrollment by eligibility group ordered by total spending. And I'm looking at the non-citizens with emergencies, and it is spiking in the 22-23 region. And then it looks like it's coming down in 24. Do we have an explanation of why the non-citizens with emergencies are spiking so bad?
Mr. Chairman, Senator Anderson, I will allow the Director of the Department of Health to speak to that. I think that's their document.
Oh, that's their document?
Who's it from?
Mr. Chairman, I could make it
Department of
up.
Health, okay. Well, at least Stefan knows what's coming. Of course, with this group, you never really know what's coming.
Sorry.
Yurts, yeah. Representative Walters. Oh, it's Sherwood. Okay, I'm sorry. All I can see is a hand.
Yes,
All right.
thank you, Mr. Chairman. I am short. So Corinne and staff, thank you guys for what you do to keep our constituents safe. I appreciate this request and this deep dive into how these programs work, so thank you for educating us. It's not an exception request, but I'm bringing it as a question today because it's something I have many constituents who have benefited from, and that's the SNAP program that probably would fall under the food security in your budget. And so thinking about the impact that I have seen and heard from my constituents in this and how that it addresses food insecurity and provides stability for families, I'm curious on what it would take to expand the SNAP program as it exists today in the state to include summertime student lunch programs. How much would that cost in general funds or federal funds? And do you have the capacity to expand the SNAP program? Thank you.
Okay,
Mr. Chairman, Representative Sherwood, so I think the program that you're mentioning specifically is what is called Sun Bucks. And it is not a SNAP program. It is a separate program altogether that looks at providing food benefits to students during the summertime. So a little bit different than what is currently provided by the Department of Education, where they provide actual food. What this does is it follows kind of a SNAP line of thinking, that food benefits are issued to families, and then those cards can be used to purchase food during the course of the summer when they're not in school. This is a program that really kind of came to light last spring. We had some conversations. I think that certainly Representative Chestick had asked us about this program previously. We did put together some numbers at that time that could probably help with what it would cost. These are all back of the envelope. So I would hope that there'd be a little bit of grace and understanding that these are completely estimates. But there's 2 categories of money that we would need. The first is the year 1 setup. We just need to get the program set up. This is a new program. We haven't done the thorough research into the type of IT system we would need to be able to manage it. Our first desire would be to look internally to see if there's any modifications to our current IT systems. But for a contractor for the IT system to get the program set up, personnel, outreach, we think the first year setup would be $2.3 million, of which about 1.15 would be general fund. The other one would be matched federal fund, 50-50. Ongoing, we would expect about $1.4 million to continue the program annually, which again is about $700,000 general fund, $7,000 federal fund. So this program does come with a match. It's a federal program. Like SNAP, the benefits do not come through our budget. So when we talk about SNAP, when we talk about EBT, those dollars go directly from the feds to a third-party vendor who puts them on a card, and then the card is mailed to the recipient. That money does not transfer through our budget. So we expect about $3.2 million worth of food benefit that would be transferred as a result.
Follow up? Okay, anything else? Okay. That's it?
Mr. Chairman, thank you for this time. I wanted to share with the group, in 2022, you all appropriated to us about $27 million for a new case management system.
I remember that.
That case management system, called YOSafe, was to replace a system that we had called YCAPS that has been our case management system since 1996. So we executed a contract with a company called Accenture with a lot of support from a project management company called Public Knowledge. And I am happy to report that we went live on time and on budget. We have fully moved into our system.
Congratulations.
Mr. Chairman, we're still unpacking boxes. We're still looking for everything. We know it's hidden away somewhere, so we are pulling those out. We have a little bit of blue tape, construction blue tape, that we're having to mark, and certainly as we clean those up. But we expect to go to operations and management. In the middle of next month, we'll have all of those quirky things cleaned up, and then we will settle in and continue to unpack our boxes. But already we're seeing much better data, much quicker turnaround time than we have ever seen previously. So thank you for taking a chance on us. I can remember very clearly sitting in this chair and listening to Chairman Bebout say, "What?" And certainly many of you also did. And I'm just happy to report that our team, our DFS team, worked so incredibly hard. It's amazing what they were able to do. And with the support of our IT vendors and our project management vendors, we made it. We got it. So thank you.
Mr. Chairman.
Yes, please, Representative Walters.
Thank you, Mr. Chairman. On that new computer system, approximately how many folks utilize, how many clients use it each year? Not your staff members, but how many people's information passes through that on an annual basis? Guesstimated, certainly not an exact number needed here.
Mr. Chairman, Representative Walters, at any given time, we have about 2,000 clients. So you could then imagine that that's about the number of clients that we're working with, and that's over the course of time. So those clients, of course, come and go, families come and go. But it's even bigger than just the case management system. It's also our payment system. So we are also paying millions and millions of dollars out of our claims system as well. So it's not just about the case management, it's also about making payments.
Okay. Anything else?
Thank you, Mr. Chairman.
Concluding remarks?
I just have very much appreciated as I've heard other directors say, the support of this committee. We went through some incredibly rough times in 2020 when we reduced our budget extensively. Working with you all during that time, I think, made it possible to find a way out, and certainly to continue to look at how we can do a lot with little. I know some of you aren't coming back, some of you are staying, and some new faces that are joining us. And I extend my appreciation to all of you, and to the new folks in the room. We are available at any time if you have any questions.
Well, and I won't be back, but I want to thank you for the professionalism that you've shown during my time here. We have faced some difficult things. I appreciate the work that you and your team and all the people in the field do. It's God's work on earth. It's nothing that I could do with seeing some of the families and the difficulties and the issues that the kids have and vulnerable adults. It's not work I could ever do. And so God bless you all for being the kind of people that do it. Yes.
Director, could you just tell us how we're doing on Stokes Hall?
Mr. Chairman and Representative Larson, on Friday, we have a meeting to review the design of Stolt Hall, which is a 1940-something building at the Wyoming Girls School that includes administration and the school. You all appropriated to us, to the Department of Construction, money to replace that building. After due diligence, we looked through, and there's no possible way that there's a good return on the investment to remodel it. So that building will be demolished, and in its place will be a new school and administrative building. We will be reviewing the budget on Friday and making final decisions about that, and then after that, it'll soon should be able to go out to bid in the phase packages.
Thank you, and thank you, Representative Larson. All right, Merry Christmas. Let me see, Department of Health is 48, I think. Yeah.
Or 48.
Yeah.
Yeah.
I think it's a posse rather than an entourage. Good to see you, Stefan, and your team. Been a while.
Thank you, Mr. Chairman, Mr. Co-Chair, members of the committee. Stefan Johansson, Director for the Wyoming Department of Health. Joined to my right by Eric McVicker, our Chief Financial Officer. Behind me in the room, just in case there are questions that I needed some help with, Stephanie Sandoval is the Senior Administrator of our Public Health Division. How's that, Mr. Chairman? Stephanie Sandoval is the Senior Administrator of our Public Health Division. Lee Grossman, Senior Administrator of Healthcare Financing, which includes Medicaid and Kid Care CHIP. Franz Fuchs is the Chief Analyst in the Director's Office. Dirk Dykstol, our Business Operations Administrator, also in my office. And last but certainly not least, Matt Petrie, who is the Senior Administrator of our Behavioral Health Division. On that note, a bit of a change coming up. In behavioral health. Matt Petrie is leaving the Department of Health. We're sad to see him go. He accepted a job to serve some new leaders in this branch of government and will be leaving the Department of Health effective next week. So while we're sad to see Matt go, I'm happy to announce that Reagan Latham, who many of you know, who has been kind of Matt's right hand, our Operations Administrator of the Behavioral Health Division, will be appointed as our interim Senior Administrator of Behavioral Health. which oversees mental health, substance abuse, early intervention and education, and the state hospital and the Life Resource Center.
It's
So
good for
big-
both of them, but where's he going?
Mr. Petrie's going to LSO.
Oh, oh.
So you
hey,
guys can
it's
boss
a
him around
step
a little
up, yeah. Usually we're being rated.
And Mr. Chairman, if I may, we also have some other Department of Health staff, Jesse Springer in the room, who is our Deputy State Medicaid Agent, who many of you know. But we're happy to farm out questions if the brain trust behind me doesn't have answers to the questions you ask. Mr. Chairman, in advance of this meeting, we did submit two materials to you, really just reference documents. So we won't spend time going through them line by line or page by page. But hopefully they are helpful. Our supplemental budget this go-around is relatively simple. I say relative in Department of Health terms because there is some complexity and nuance. But the Department of Health budget writ large, as you all know, is long and complex. So accordingly, over the years, we've prepared some summary materials that hopefully help you all as decision makers more as reference documents, things you can look at quickly and get some summary statistics or information about the department. The budget roadmap document, which is 4 or 5 pages that you should have in front of you, it's really intended to summarize the Department of Health's relatively large budget in a more concise manner. That overview on the first page shows a dollar and percentage breakout of where the Department of Health budget goes. So that first table really collapses a lot of our budget categories into what I think are more understandable and discernible categories than might be listed throughout the numerous budget units, historic budget units in the department. Table 2 on the second page of that document shows the agency's position breakdown between Cheyenne, field offices, and facilities. So kind of a summary of this document, the takeaways for me, and many of you have seen versions of these documents over the years, it's important to remember that of the department's approximate $2 billion biennial budget, around 90% of that goes out the door in forms of payment to providers, to community organizations across all of the communities in Wyoming. Much of that is on the Medicaid side, both in terms of state plan services, but also our specialty programs like our developmental disability waivers, our long-term care waivers, services that pay private providers to deliver those much-needed care to folks in the community. And secondly, Mr. Chairman, on the staffing side, I know there's been a lot of questions about positions and location of positions. Department of Health is a bit of a unique organizational structure. I mentioned that the vast majority of our budget goes out the door in forms of provider reimbursements. On the staffing side, the vast majority of our personnel are not located in Cheyenne. Most of our personnel are in our 5 direct care facilities: the State Hospital in Evanston, Life Resource Center in Lander, Pioneer Home in Thermopolis, the Retirement Center in Basin, and the Veterans Home in Buffalo, as well as public health nursing offices that exist in every county, delivering direct health care, immunizations, home visitation to new mothers, et cetera, as well as our women, infant, and children offices, which are also in your communities, delivering nutrition programs to new moms, new low-income moms. So always a little bit eye-opening for me to see how much of our dollars leave Cheyenne going out to the community, but also how much of our personnel, our 100 series, support direct care either in 24/7 safety net facilities or in those field offices. We also provided another document. This is relatively new. It's called Wyoming Medicaid and CHIP Monthly Snapshot. Many of you know we've experimented over the years with dashboards, with reports, because Medicaid is such a big program relative to the Department of Health's budget, and we serve between 60 and 80,000 people on Medicaid in the various programs. It's large, it's complicated. There's a lot of different coverage types, there's a lot of different types of expenditures. And with our new technology system that you all invested in over the last 6 or 7 years, we have the ability, in my view, to provide a much greater level of detail and report automatically and do better analytics for our decision makers. So in addition to seeing how we monitor, measure, and manage the performance of Medicaid, We worked with many of you and other legislators over the past 1 to 2 years, having some informal meetings, sharing this on the screen in virtual meetings, and really getting your feedback on what's most helpful if you were to take a document at a glance, look at Medicaid enrollment, look at Medicaid costs, what's helpful to you all as decision makers. And so this is the most recent iteration of that. It updates automatically every week or whenever we run the code, again, attributable to the new technology that we have in the Department of Health and in Medicaid. And again, hopefully can help answer some questions on the spot, at moment's notice, when you all are making tough decisions on what are very often, complicated programs, complicated state law, federal law, regulations when it comes to Medicaid and our Medicaid waiver programs. So again, Mr. Chairman, we won't go through those in great detail. Just hope that it's a helpful reference document for you to use as we enter another legislative session. And with that, Mr. Chairman, if there's no introductory questions, happy to dive into our supplemental requests.
Any questions, introductory questions? Yes. Okay, Senator Anderson.
Yes, there is. I hold up this presentation again. So you know the question, why are the non-citizen emergencies spiking so bad and from 20 to 24?
Mr. Chairman, Senator Anderson, a good question. And just for everyone else's reference, if you turn to page 3 of that Medicaid snapshot, you'll get a sense of what Senator Anderson's referring to. This shows overall enrollment by different categories in Medicaid over time, going back to 2016. And you see in a couple different categories, I'll mention a few: children, family care adults, pregnant women, breast and cervical cancer, and the category you're mentioning, Senator Anderson, non-citizens with emergencies. That is a very specific category required federally in Medicaid, where non-citizens do not qualify for Medicaid traditionally, but we are required to pay for emergency care when non-citizens show up in the emergency room, for example. In those categories I mentioned where you see a spike in enrollment really starting in 2020, that is directly related to a federal policy that was enacted in 2020 during the COVID-19 pandemic, which prevented all Medicaid programs from disenrolling any members, even if they would not have been found eligible. And eligibility in Medicaid churns, it waxes and wanes. Folks get a job, have higher income, become ineligible. Traditionally, as we've always done, we would have done the annual renewal or enrollment renewal, and if they don't qualify, we would disenroll. The federal government stipulated that during the public health emergency, during the pandemic, Medicaid programs were not allowed to disenroll. And so you see in some of those categories spikes in enrollment. I will note on the non-citizens with emergencies, look at the left-hand pane there. It is relatively low volume. We're talking generally less than 100 people in any given year. But we weren't able to take them off the rolls of Medicaid. And so across those categories, you do see artificially high enrollment from 2020 really to the end of 2023. And then you see a precipitous decline because after that federal policy was eliminated, when the public health emergency was declared federally to be over, we began the process of what we call unwinding that policy, starting the disenrollments and cleaning up the rolls of Medicaid eligibility. If I can linger just briefly, Mr. Chairman, because it's an important point, during that public health emergency period, where you do see artificially inflated enrollment because we were not disenrolling folks off of Medicaid, you would expect a far greater percentage of expenditures because folks who would have been disenrolled would be using health care. Their Medicaid eligibility was continuous, and therefore we would expect higher than normal expenditures. We did see some inflation in expenditures, but we didn't see, like some other states did, a massive increase in utilization of healthcare services from that population. In addition, the federal government, by nature of that policy, as many of you might remember, enacted an enhanced federal match. So we had enhanced federal match during that time period to offset any of those expenditure increases that didn't have to rely solely on the state portion of Medicaid expenditures.
So, Mr. Chairman, follow up. So that Medicaid match, we furnished 10%, 20%, or something for non-citizens?
Mr. Chairman, traditionally in Medicaid, there's some exceptions, but Wyoming is at the floor of the federal match rate. We are a 50-50 state by and large. So outside of the public health emergency, the pandemic, we typically look at our Medicaid expenditures as 50% state funds, 50% federal funds. The enhanced match from the state, I believe, was 6.2% during the public health emergency. So our effective match rate from the feds went up from 50% to 56.2% during that time period.
Well, bless their heart.
Please, Representative Larson.
If I could, Mr. Chairman, just been digesting those numbers that you shared with us on the other document, that I think sometimes we get the impression that government doesn't do anything to contribute to the economy of the state. But if I'm reading you right, 82.5% of this budget comes out to private and nonprofit providers. So that's hospitals, doctor's office, whether private or public. All of those that provide services that are being paid, that provide that employees, and then of the remaining, there's another 10% for those 5 facilities around the state, which are some of the larger employers in the community. So my question to you is, how does that percentage compare with some of our either neighboring states or other states as a whole?
Mr. Chairman, Representative Larson, bit of a mixed bag. Structures of health departments are different in other states. But for example, our neighboring state to the east, Nebraska, is also considered what we affectionately call a super agency, where Medicaid, public health, behavioral health are all under the purview of the Department of Health. In the cases like that, it's similar. You have other states where, what is a public health division for us is its own department in other states. What is, I think, unique and interesting about the Wyoming Department of Health is some of the percentages you're mentioning, where other state agencies, even other large organizations, private businesses, typically see anywhere from 30 to 60% of their overall expenditures on the personnel, overhead, et cetera. Because of the programs that the legislature entrusts to the Department of Health, including Medicaid, our developmental disability waivers, long-term care programs, paying for nursing home stays, community mental health centers, senior centers, because that is such a large percentage of what we do, the Department of Health is somewhat flipped in that regard, where, again, as you can see with the numbers, a smaller fraction of our overall expenditures are on the personnel side. So no real policy statement there one way or the other. It's just somewhat unique in terms of a large organization that doesn't see a significant portion of its expenditures or as significant on the personnel or overhead side.
Okay, anything else before he launches in? Nothing, launch away.
Thank you, Mr. Chairman. We will go ahead and dive in. The summary table on our supplemental budget request of all of the exception requests starts on page 10. I'll ask committee's discretion here. We can begin on a page turn. Our first request is on page 15 in the director's office, but it is interrelated with a request in healthcare financing. So it might be more beneficial to start on page 21 in healthcare financing, because we will reference the other request.
Page 21.
And Mr. Chairman, per the usual, since Mr. McVicker practices this for months and months before this meeting, I'll ask him to announce the budget unit and page number and whether we have an exception request.
My best impromptu speeches are carefully rehearsed, so I respect you, Eric.
Mr. Chairman, members of the committee, we're on page 21, Unit 401, Healthcare Financing Administration, and we have 2 exception requests in this unit.
So, Mr. Chairman, starting on page 21, bottom of page 21, this is priority number 3 for the Department of Health, and this is in our Medicaid long-term care eligibility unit. These are folks that work eligibility specific, and with state staff, work eligibility specifically for our long-term care programs. The best example, most understandable example of that for me are folks that are applying for Medicaid coverage because they are in or their family member is in a nursing home, a nursing facility. As you see from the narrative there, our target just for retention, turnover mitigation, and also quality customer service is to have about 550 total cases per eligibility worker, and we have exceeded that. Many other directors that you've heard from this week have talked about Wyoming's demographics. We reported to this committee and others a lot over the past 10 years on the changing demographics, the aging population, and what that means for long-term care programs, and Medicaid is no exception to that. This has been a tough unit to staff. Our turnover has been high. Our eligibility workers in this unit do a lot of work with very complicated cases. There's federal and state requirements to make sure we're assessing all of the financial eligibility information correctly, interfacing with the appropriate federal and state systems for income, for assets, but also making sure that we are providing good customer service to folks who need it and are in a position where long-term care is expensive, assets run out for families, and Medicaid is there to pick up that slack. We would like to bring our average cases per eligibility worker down to a more meaningful rate and hopefully increase our retention of those employees by not overworking them. So this is a request for one additional position in that unit. It's our only net positive position request, which you all know I'm reluctant to bring additional staffing requests to this committee, but in this case, I believe it's necessary.
So Stefan, these are the nursing home screeners, the people that screen for nursing homes?
Mr. Chairman, that's correct, and many of you know, so forgive me for being redundant, the Medicaid program contracts out a lot of its customer service through our customer service center, both for online applications, telephonic, and in person. That's generally how Medicaid applications are processed. With long-term care, it's more complex. We like to have state staff work those cases. I've mentioned before, the customer service center is a difficult call center and customer service enterprise to manage through contract. We do that through contract mechanisms, try to increase and improve the performance of our contractors as much as we can. In this case, with a few state staff, we have found it beneficial to work the more complicated cases in a more high-touch oriented environment because of the complexity of these cases.
Okay. And then you said somehow this relates to another request for earlier in the book?
A subsequent request will relate to the director's office, not this
Gotcha.
one, Mr. Chairman.
All right. Next.
Next, Mr. Chairman, on page 22, this is priority number 10, Medicaid Technology Project Management Office staffing. We are proposing to convert a handful of AWAC positions to permanent positions, and this is the request, Mr. Chairman, that does relate to the director's office, which is on page 15. What we have seen since the legislature authorized us to replace and modify our Medicaid technology enterprise, some of you will remember that as the WINGS project. That was going back about 8 years when that project started. That project has been completed and successful. We have wonderful new technology modules in the Medicaid space. At that time, when you approved the federal funds for the technology replacement project and the 10% state match for that expenditure, there was a lot of discussion about the personnel needed to run this new technology enterprise. As part of that compromise and negotiation, we moved contract AWAC positions from the director's office into healthcare financing. Mr. Chairman, over recent years, Jesse Springer, who has really headed up that Wings project, we have noticed, and we can give you a lot of information about the retention and turnover of these positions. Under an AWAC contract, that's on an annual basis, limited benefit package, it's been difficult to retain. And in broad numbers, we're typically about 50% vacant on those positions. These are highly skilled. You can imagine the technology infrastructure we're talking about. We train people up, get them to the point where they can work with, negotiate with technology vendors. Unsurprisingly, they get poached either by those technology vendors or even the federal government, Centers Medicare and Medicaid Services. We've seen folks leave this area for that. This is a net reduction in general fund if we made this conversion because of the match rate we receive here. The director's office provision that I mentioned, Mr. Chairman, on page 15, you see a reduction in overall expenditures there. So this request is really to convert those AWACS with no general fund exposure and in fact, a general fund savings to be permanent positions. And we feel that our retention will improve with those positions because we can not be operating on an annual contract basis with that relative insecurity that staff members like that might have of if the contract will be renewed, and also be able to provide annual leave, vacation, sick leave, those types of benefits.
Questions?
Mr. Chairman?
Senator Anderson.
Mr. Chairman, do you have a good explanation of why the governor denied that?
Mr. Chairman, Senator Anderson, as you all heard from Governor Gordon, and I do not disagree, our direction as agencies was to put forward what we thought were emergent requests. I believe that this is one of them, but on the personnel side, I understand the logic also of making those moves, making those changes in a budget session, both for the long-term care eligibility position that we just discussed, as well as conversions like this of AWACS to permanent positions. So it was a good, healthy, robust discussion. I still believe this would be beneficial in the short term, but if it's the will of this body or the legislature to wait until we're setting the budget for 27-28 biennium, we will continue to manage as is for now.
Mr. Chairman, follow up.
Follow up for Senator Anderson. Then.
It looks to me like that saves quite a bit of money. We would take 2,534 out of the general fund, and I'm assuming that AWAC salaries are coming out of the general fund now, or are they coming from somewhere else?
Mr. Chairman, I'll let my CFO answer that.
Yeah, Mr. Chairman and Senator Anderson, the positions that are in the director's office are 100% general funds. That's where we're going to see most of the savings because when we use them for wings, we'll get 90% federal match and 10%, or 90% federal, 10% general fund. So that's where we're seeing most of the savings is from those positions.
Geez, I like this savings we're looking at here on this one, supplemental or other budget. Thank you.
Representative.
Thank you. I guess just a little repetitious. It seems to me that we would want to save those general fund dollars and utilize that. And I think it's on both of these requests, the one here and then the one on 15, that we have the ability to have some general fund savings. Is that right, Eric?
Mr. Chairman, Representative Larson, that's correct. We would save approximately in all 5 of those positions, about $47,000 in general fund savings.
Okay.
So, Mr. Chairman, we're on page 27. It's Unit 460. It's Adult Services in the Healthcare Financing Division, and we have 2 exception requests in this unit.
Okay.
Mr. Chairman, members of the committee, so page 27, priority number 1 for the Department of Health. This is what we're calling maternity care rate rebasing. Just very, very brief background from the last 12 months. The Joint Labor Health Interim Committee set maternity care and what was termed maternity care deserts as one of their interim topics and discussed at length both with the Department of Health and other stakeholders. Some of the trends, in many cases concerning trends we're seeing with maternity care, labor and delivery, et cetera, not being provided in all of our communities and in some of our hospitals. We had proposed several policy options or presented on several policy options last spring in front of the Labor Health Committee on what could be possible. This is an extension of one of those options where one of the levers we have as a Department of Health to influence something like the availability of certain types of services in communities or providers. We are a big payer for healthcare. In addition to managing facilities, other types of programs, Medicaid program pays for healthcare for the folks that are eligible. And so by nature of that, we have policy levers, especially on the fiscal side with our reimbursement rates, to influence, at least partially, some of the markets we see in Wyoming communities and services that may or may not be available. In this particular request, we are proposing to increase physician reimbursement rates, especially in OB/GYN care, labor and delivery, to 105% of Medicare. And I'll pause there and just mention that you'll hear our department talk about percent of cost coverage or cost coverage in general a lot. What we're always bouncing off of when we say those things are allowable costs from federally submitted cost reports from providers that submit those. Those are hospitals and nursing homes. And when we say a percentage of Medicare, that's because this term we also use called the upper payment limit is typically what we bounce off of to gauge how close are Wyoming Medicaid's reimbursement rates to allowable costs, to cost coverage in those providers. We know from our analysis that in these rates, we are below that 100% of Medicare or cost coverage, and in this case, we would be increasing that to 105% of Medicare. So the idea, in a nutshell, very simply, is to pay closer or above cost for these types of services to influence the availability and provision of those services.
Stephen, you keep saying Medicare, but with OB/GYN, it's probably not too many Medicare.
Mr. Chairman, I'm glad you brought that up. The governor brought that exact point up in our budget meeting and said how many of our Medicare recipients are
Delivering
having
babies.
OB/GYN or
Yeah.
labor and delivery. Good point, made me chuckle. Nevertheless, all of those costs are still part of the overall cost report that's submitted to the federal government. So you're right, Medicare does not cover these services, but we still bounce off of and say it's a percentage of Medicare allowable costs.
Okay.
The natural question, Mr. Chairman, from the committee I would anticipate would be, okay, we've had even recent an announcement of a OB care and labor and delivery going away in one of our communities. We've had two other communities in recent memory decide to not provide those services through their hospitals as well. So the natural question is, will a rate increase like this bring those services back online in those communities? And I can't answer that with a definitive yes. In fact, if you pushed me, I would probably say it's unlikely that those services would come back online. Given that Medicaid is only part of the payer mix for these services, we're about 25 to 30% of all births in Wyoming are Medicaid births. But this is a measure, a modest measure that the state could take to hopefully stave off additional decisions from providers to scale back or eliminate these services in communities.
Well, let's look at that a little bit. In the rural counties where it's the biggest issue, I would ask, because I would speculate that perhaps the poverty rate is higher and the Medicaid enrollment rate might be higher and the percentage of births on Medicaid might be significantly higher than the 30%, such that it could make a big difference. Assuming that to be true, or even if not, is it possible just to bump up the reimbursement in those counties where we know we really have an issue? We're not gonna lose OB/GYNs in Sheridan and Casper and Gillette and Cheyenne. So why bump up the reimbursement there, and why not double down in the counties, the rural counties where you need it the most? Is there anything stopping you from doing that? I suppose the feds probably have some rule against it, but couldn't you target just the areas you want?
Mr. Chairman, before he answers that, I beg to differ on where the Medicaid pregnancies are. Those pregnancies are all coming to Casper, Cheyenne, Sheridan, Gillette. They're not taking place in any small communities because there's no facilities available. In fact, I don't think there's any available now in Evanston. So I beg to differ that it's small communities. These are large communities, and I'm shocked to hear you say that 30-some% are Medicaid births. In our area, it's more like 85% are Medicaid births. So that is a big city problem.
Well, Jim, I think we're on the same page. They're coming to Casper because their rural communities don't have any care.
That's right.
Yeah.
And Mr. Chairman, if I may, not offering to referee this debate, but we're more than happy. We do have a bi-county Medicaid birth report that the team at Healthcare Financing puts together that might be helpful as you weigh this decision, this policy decision. But to the points that both of you made, good points that both of you made, without specific authority, sometimes waiver authority, when we're raising reimbursement rates for a covered service or an enrolled provider group, typically that is a blanket approach. Now, there are ways to target reimbursement rates to certain things that you want. I believe we're doing that here. But Chairman Kinski, to your point, that would not be as simple in a state plan amendment because of the regulations we fall under. But we're happy to share that Medicaid birth report. So I'm giving you the average numbers that in any given year, it has come down over the past several years of the percentage of Wyoming births that are on Medicaid. But it typically hovers around that 25 to 30%, but it is somewhat variable.
Please, Representative.
Thank you, Director Johansson. On your explanation, you note, so we're saying to get this accomplished, we need an additional 1.1 general funds, and then we'll get matching funds. But in your narrative, you note that it appears to me that then we're also getting this accomplished by reducing the anesthesia codes and a couple of CPT codes. That must have been above 100% down to 90. And so you're capturing some of that cost in those reductions as well?
Mr. Chairman, I suppose I have permission since he's gone, but Representative Larson, yes, we, as we do in many of these rate discussions, we do rate studies and analysis to see where are we significant below that upper payment limit or percentage of Medicare, and what services are we significantly above? Anesthesiology is one of those in this request.
And so then my follow-up question, Mr. Chairman, would be, we're not negatively impacting those that you reduce, is one question. But then if we didn't adjust any of those, what would this cost have been?
Mr. Chairman, I'll ask either our Medicaid administrator or deputy administrator, Mr. Springer, if we have that detail, we can provide that. I don't have it in front of me.
Okay.
I'm hearing that we've got it, so I'll hand it over to Mr. Grossman.
The bearded men.
Mr. Chairman, Representative Larson, Lee Grossman with the Wyoming Department of Health State Medicaid agent. So to get right to the point, that would be a reduction, right? So this ask would be higher if we kept the current anesthesiologist rate as is, which I believe is about 120% of Medicare, 125% of Medicare. So it's significantly above what it is if we enacted this particular item. So that would be about 500,000 is our projection. So if we wanted to keep that anesthesiologist rates and those codes as they are today, that would cost about 500,000 above and beyond what we have here.
Thank you.
Okay. If nothing else, please proceed. They seem to be
Okay,
anxious to
Mr.
get away
Chairman,
from you.
we're just shuffling paperwork here, forgive me. Moving to page 28, this is our priority number 2, Medicaid behavioral health rate rebasing. As you all know, we've been undergoing significant changes outside of Medicaid to our behavioral health system. With the legislature's direction, we've completely reformed our community mental health, behavioral health center, priority populations, as well as the payment model, something I'll mention later that we're very excited and optimistic about. But in the Medicaid program specifically, we conducted a rate analysis similar to what we just discussed on maternity care for all of our behavioral health reimbursement rates, and also noticed areas where we're paying significantly below projected or average cost to deliver those services. Given the governor's priority around behavioral health, my department's priority around behavioral health as well, this would be approximately $800,000 of, $833,000 of general fund matched by $833,000 of federal funds, and would allow us to increase the rates we pay behavioral health providers for Medicaid eligible populations. Specifically, including outpatient mental health, substance use services, and something that's relatively new and somewhat new in Wyoming, what we call ABA, or Applied Behavioral Analysis Services. These are services that are becoming more and more voluminous and frequent for especially children on the autism spectrum. It's a new type of provider, and something that I know members of this committee worked on a couple of years ago to make sure that was in our licensure statutes with the Board of Psychology, to be able to have that type of coverage and reimbursement, both in public payers like Medicaid and private insurance, to be able to pay for ABA or applied behavioral analysis services. That's part of this rate rebasing, and I'll stop there, Mr. Chairman, see if there are any questions.
Questions? Proceed.
Mr. Chair and members of the committee, we're currently on page 30 now. Unit 461, healthcare financing, children's services. We have one exception request in this unit.
Mr. Chairman, rounding out our exception request on the Medicaid side, this is for a modest increase to home health rates, home health services that are delivered under what we call the Medicaid state plan. So this is not under special waiver provisions, either our long-term care waiver or our developmental disability waiver. These are services that are provided and reimbursed through the Medicaid state plan. Typically, these services are delivered to children with high medical needs, often skilled nursing services that need to be provided in the home due to significant medical issues, equipment, things of that nature, that support children who have a home health provider. What we found in our analysis is we are significantly below estimated cost coverage here. This request would take our Medicaid home health rate cost coverage up to an estimated 70% of cost. So we are targeting still a low cost coverage, but something that we believe will improve the availability of providers. And I'll pause there, Mr. Chairman, to mention this conceptually is related to a few actions this committee took over the last 2 years. If you'll recall, 2 years ago in our budget hearing, I alerted the committee after discussions with the Wyoming Dental Association, several dental providers saying we want to keep providing services, cleanings, et cetera, to Medicaid kids, but we can't do it anymore because of your reimbursement rates. We took that seriously, did the analysis very similar to this, looking at cost coverage to try to avoid providers exiting the Medicaid programs, mostly serving kids who needed dental services. This is somewhat similar, where we have been alerted that in terms of home health, providers saying, we don't believe we can keep providing this service. And in my view, these are often and can be critical services, especially for children who need them. And I have concern that we could lose providers if we don't take a modest action to, and I'll say relatively modest. I know Department of Health numbers are large. I'm very sensitive to that. But this would bring us up to an estimated 70% cost coverage for those providers that we think could at least stave off providers choosing to exit that system.
Mr. Chairman.
Representative Larson and Senator Anderson.
To that extent, I think in my conversation, if you just refresh me, as we've talked to some constituents in my part of the world that we're trying to find these services, they are very difficult to find because of that reimbursement rate, and hence trying to find some other options that they could be self-serving. That becomes problematic with with Lee's unit because they might be the parent, then they can't, or the guardian, then they can't be the recipient of that payment. And so having the ability to provide those services has become really pretty difficult.
Mr. Chairman, Representative Larson, yes, I'd agree with that.
Mr. Chairman, I've had more complaints in my area from the home health care people about this. What's the reimbursement rate now? Is it 50% of Medicare rate, or where are we? Because we are absolutely too low.
Mr. Chairman, it does depend on the provider and their business model, but on average, we're around 50% cost coverage, with some as low as 35%.
Well, this jump will help, but it doesn't solve the problem. This problem is bigger than this. It needs more than 70% of that Medicare rate. We're losing home health care people for Medicaid patients because they're not getting reimbursed enough. Thank you.
Okay,
Mr. Chairman, we're moving on to page 35, and now we're in the Public Health Division. This is Unit 525, Women's, Infants, and Children, and there's one exception request here.
Mr. Chairman, members of the committee, a simple exception request here. We are requesting to convert 12 part-time WIC, or Women and Infant Children, positions to full-time equivalent positions, which we have listed there on page 35. This does not require a general fund appropriation. We can cover this with the federal funds that we receive. And these part-time positions, we're just having trouble managing the WIC services and offices just using these part-time positions. Without the need for general fund here, and in fact, mostly because our accountants are creative to make things balance, you actually have a $5 savings, so you're welcome, that you see there listed on the table. We think this will improve our unit's ability to recruit and retain, hiring full-time equivalent positions here.
so if you got 12 people working part-time and you hire 12 people full-time, wouldn't they have less workload because they were only working part-time before?
Mr. Chairman, it's a good point. It is mixed. We don't only have part-time positions in WIC, in our field offices out around the state.
So it's a government thing where when you call them part-time, they're really full-time?
Mr. Chairman, I worry it's becoming that way, that we
Okay.
are trying to, and, using overtime, things of that nature. It would be beneficial for our operations, in my opinion, to just have them as full-time equivalents.
All right. I'm just being smart, sorry. Yes, Representative Larson.
Do they feel like those federal funds are sustainable? I mean, is that something that has been in existence for a long time and won't disappear 2 years from now?
Mr. Chairman, Representative Larson, I'll certainly let Ms. Sandoval correct me if I'm mistaken here. This is not relying on transient or part-time grant funding. These are federal funds that we have in the budget.
Thank you.
Okay, Mr. Chairman, members of the committee, we're now on page 41, Unit 526, Public Health Nursing, and there is one exception request here.
Mr. Chairman, on page 41, County Public Health Nursing Staff Funding, bit of history. Apologize for all the history lessons today, but last session, there was a bill that the legislature passed that when the state increases compensation, and bear in mind, in the Department of Health, we employ a lot of nurses and a lot of CNAs, mostly at our facilities, but also at our public health offices. You all passed a bill that when the state compensation changes for those types of employees, that independent county public health offices, of which we have a handful, who operate their public health offices with county employees instead of state employees, we must request to equalize that when anytime the state makes a change to, in this case, nursing positions. Last January, almost a year ago, we worked with the Department of Administration and Information, A&I. As you all know, we have really struggled on the recruitment and retention at our state facilities for nurses and CNAs. And using budget savings that we had, we made a modest increase to certain nurse positions, entry-level nurse positions, and certain entry-level CNA positions to attempt to be more competitive at the state hospital, at the retirement center in Basin, at the Life Resource Center in Lander. What you see in this request is based on that change that the Department of Health made for our nurses, including our state public health nursing positions. This is a request we are compelled by statute to make to you all to equalize that for the independent county offices. It's a total of just under $64,000 submitted for your consideration, Mr. Chairman.
Chairman?
Please,
Thank you, Mr.
Representative.
Chairman. I see the governor recommends denying this expenditure, and that puts the state out of compliance with its own state laws. Can you explain why he would? I recognize it's a supplemental, but following state law is also what I would consider of an emergency nature.
Mr. Chairman, Representative Walters, good question. Minor correction that the bill that passed does not require the state to implement those salary adjustments. It requires the Department of Health to bring the budget request to this committee and to the legislature to consider those adjustments. So very similar to what we'll discuss here in a minute with the developmental preschools, the EIEP program, compelling the department to request these things does not require the state, the legislature, to fund them. So the exception request here, there was a lengthy debate because we consider our county public health offices to be partners with us, part of our public health workforce, doing very similar, if not the exact same jobs that the state public health offices around the state complete. It's an interesting dynamic here where that bill that passed really grew out of the larger state employee compensation package that you all passed a couple of years ago, not just for nurses, not just for health professionals, but for all state employees. That was a much larger number, and you all took action to make sure that those independent county offices received state general funds to be able to increase those county public health nurse salaries. This is a little bit different in the sense that the state, the legislature, did not make an across-the-board change to compensation. We did, the Department of Health, for very specific nursing and healthcare positions that we have at our facilities. So I actually asked the question, Representative Walters, to our attorneys, to the state auditor, to Mr. Richards at LSO, help me interpret this. Anytime we make a change, which could be very specific or it could be broader, does that bill require us to bring this request? And I think the general conclusion was yes. And I think it's a fair debate to have. It's a very low amount here, relatively speaking, but that's it in a nutshell.
Okay, Mr. Chairman, members of the committee, we're moving on to the Behavioral Health Division, page 46. It is the 2510 unit, it's preschool services. There's one exception request here.
Thank you, Eric. Mr. Chairman, members of the committee, one of the more complicated and nuanced requests that we have, so bear with me, quite a bit of moving parts, especially over the last year here. This is in our Behavioral Health Division, priority number 4, for our Early Intervention and Education Program, or EIEP, what some folks will refer to as our developmental preschool providers. We are required as a department to bring exception requests to this committee, to the legislature every year for increases in the child count for the developmental preschools and for external cost adjustments, which I'll talk about briefly as well. But it's worthwhile to mention that a lot of changes have happened legislatively around this program just in the last session. An Enrolled Act was passed that changed not only the per child amount that we are directed to pay the developmental preschools for serving these children with higher needs, but also directed implementation of a new external cost adjustment, or ECA, methodology. Historically, that ECA for the developmental preschools used one inflation index. The bill from this past session aligned it with the K through 12 system to use 3 inflationary indices to calculate what the external cost adjustment is. In addition, the bill changed the child count date, what used to be December 1st, to May. So we have a new child count date, which has already happened. The child count happened this past May. So there's a lot going into this request, both in terms of the child count, the external cost adjustment, the timing of both of those, and finally, something that's worth mentioning here, the Enrolled Act passed last session, but the budget bill had a different amount appropriated in it with a footnote specifying that no more than 12.2 million should be appropriated for this purpose, what happened last year that took effect on July 1st. And so there's a bit of a conflict between what's in the Enrolled Act and what's in the budget bill. So we implemented the appropriation from last year that was in the budget bill, which was $12.2 million, about $4 million less than what was approved by both chambers in the Enrolled Act. So again, about 3 or 4 different variables going into this request. But what is it? This request represents an increase in child count that happened in May, the new current year external cost adjustment, or ECA, and the difference between what we're directed to pay in a per child amount in the Enrolled Act and what was appropriated in the budget bill, which was less than the Enrolled Act. Mr. Chairman, my head spins a little bit trying to just describe all of those variables, but that's the budget request in a nutshell. You'll also see on page 46 and going into page 47, we provide a table, since we bring a request similar like this every year because statute compels us to, all of the action that the legislature has taken over the past several years when it comes to the external cost adjustment for the developmental preschools. And in some years, as you see, there was no action taken, $0 for the ECA. In some years, it was $1 million, $4 million, and last year was a more sizable investment, kind of as that Enrolled Act, as the committees were discussing that bill, a more sizable investment was appropriated last year of around $12 million. So the difference of all of those things is what you see in this budget request. Mr. Chairman, with that, happy to answer any questions. I know that's a lot of information.
Mr. Chairman,
Please.
this ECA, is it included in the education ECA? Because I think they have a ECA of 60 million or something. Is your 11 million in there, or is this separate?
Mr. Chairman, Senator Anderson, so how it has traditionally worked and still works that way, although it's changed a little bit, is that we get the ECA calculation, the percentage passed on to us from the Department of Education. In previous years, it would be calculated on that one inflation index I mentioned before. With the passage of last year's bill, now the ECA for this program more aligns with the K through 12 system to use the multiple inflation index calculator, which also gets passed on to the Department of Health to calculate the ECA for this program, similar to how it's calculated for the K through 12. The operative difference is this is a very different program than the K through 12 system for very specific services, both for 0 to 2-year-olds in what we call the Part C program, and for 3 to 5-year-olds in what we call the Part B program. These are all preschool services whose aim is to provide services to kids with developmental disabilities or developmental delays, to serve them in an appropriate setting, in a combined setting, and also prepare them for the K through 12 system, and hopefully improve or eliminate those developmental delays.
Representative Larson.
So as I try to get my head around this, Stephen, where I can understand what we're doing, it looks like we kind of have 2 components really. But those are a result of the actions we took last year, with the biggest one being that we adjusted the per child count to $12,300 each. So then when you went to do those contracts, our language is always based upon the amounts available, and we didn't have all it took to meet that contract. And it appears we were short of delivering that amount by the 8.4 million. Boom, so that takes care of that. Then the second thing is last year we done an ECA for K-12. It was a year that this committee will remember we had high energy costs, I want to say around 20%, something like that was the indices, the indices,
Right.
Professional services, but it was a high amount. So that was done last year. So the request for that external cost adjustment for the developmental preschools is always 1 year behind. And so to get that ECA, which now includes all of those indices, there's a that would require 3.2 million, which gets us to that 11.7. So do I have that right?
Mr. Chairman, yes, you have that correct.
Senator Anderson.
Mr. Chairman, I'm seeing the governor is denying this, but this is part of our maintenance of effort. Is there consequences for us not meeting our maintenance of effort?
Mr. Chairman, Senator Anderson, great question. So our maintenance of effort, that is really a federal provision, stipulates that when states spend whatever their spending is in these types of programs, special education, and in this case for young preschool-age children, the maintenance of effort requires that you cannot go below that amount unless there's very specific conditions met, budget cuts, precipitous revenue declines, those types of things. So until you spend or budget those dollars, the MOE, the maintenance of effort, does not take effect. So if this body, if the legislature decided not to do this, I don't believe we would have a maintenance of effort issue. And it begs another question of, what is the legislature's options here? And as Representative Larson described, you've always had kind of a choose your own adventure option when it comes to EIEP, because over the years, as you see on the table, you've elected in some years to appropriate some money for the ECA and other years to not appropriate money for the ECA. And we will do our calculations to determine, even if there's a per child amount in statute, based on available appropriations, how do we adjust that per child amount? So I don't see an MOE, maintenance of effort issue here at the federal level. But I'll use this as an opportunity to reiterate a frustration that you all have heard from me for many, many years, that this is a classic situation with maintenance of effort where the tail wags the dog. Our federal funding in this program, I think, is 7%. So it's a $70+ million program. Almost all of it is general fund, a state general fund. So maintenance of effort always frustrates me when the state is spending most of the money for these services and programs, and we worry and do this calculus about because of the federal provision of you can't spend less, it is just frustrating. But again, historically, the legislature has chosen different times to appropriate additional per child amounts or external cost adjustments, and other times where it's chosen not to.
Mr. Chairman? So we were getting brave and bold on the maintenance of effort conversation, going a little bit into last year to your point, and we kind of said, particularly like on Part C, fine. The majority of this, and so if we lose the Part C, okay, we'll keep funding it. But then on the Part B side, which is the same 5 to 21,
3 to 21.
3 to 21, thank you. The Part B is the same maintenance of effort required by K-12.
Correct.
And there's this concern that if we snubbed our nose at this low maintenance of effort, or this low federal funding we get in this program, that it could have a huge impact on the K-12 federal funds. Am I saying that accurately?
Mr. Chairman, Representative Larson, yes, and I appreciate you bringing it up because it's worth mentioning, especially if our Department of Education colleagues are listening. There is a concern in this program that when we've had to cut budgets over the years, does that influence their maintenance of effort, or what is called MFS, maintenance of financial support, more broadly in K through 12 special education? And I would say at best, there's a risk there, and it's a gray area. As I mentioned, in federal code and CFR, there are provisions where states can waive out of maintenance of effort in certain times. Like I said, precipitous revenue decline for the state, budget cuts, those are often temporary permissions. But yes, this program interacts heavily, both financially and regulatory-wise, with with our sister agency in the Department of Education. So we are in communication with them often on any sort of appropriations or in the times we've had to reduce the budgets of what the broader impacts are to the K through 12 system.
And so then follow up, Mr. Chairman. When we talk about, are we getting in jeopardy? So even though we raised the amount to $12,300 per child account, unless we actually spend that amount, there's not a maintenance of effort requirement. It's once you appropriate the funds to be, we could have it $1 million a child, but if we only put $5 in, that's our maintenance of effort.
Mr. Chairman, Representative Larson, I'll hedge a little bit here. In general, yes. Maintenance of effort is on expenditure. However, there is maintenance of effort that is claimed in Wyoming, both in education and in this program on budget, meaning when the amount is budgeted, that's what we're using to calculate MOE. And there's some good reasons for that over the years, where when we hit the revenue declines and the governor and this body directed our step 2 reductions, which for the Department of Health were over $100 million, we looked at under every rock we could so as not to overly punish our providers, and in this case, developmental preschools. What can we use to calculate MOE to satisfy that federal requirement? Working with our federal partners to look at expenditures, in-kind contributions from the providers, from communities to capture as MOE, so that we didn't have to not only cut the general fund out of those budgets, but then lose federal funds by nature of doing that for violating maintenance of effort. But in general, yes, the maintenance of effort from the federal government in this program and in special education in general, if you do not budget and expend it, you have not set a new ceiling or a new floor for your maintenance of effort.
And then one final, please, Mr. Chairman. So my request, if I may, Mr. Chairman, and might be beneficial, is here we are funding this education thing with general fund dollars all the time, right? And we've howled and yelled a little bit about using school foundation program dollars, and we've attempted to do that a little bit. So could we maybe just look and see if there are, within your budget, any school foundation dollars that maybe we could capture and use that might offset some of this? And then that would help us, you know, if we want to come back and really look at getting particularly this ECA funded. And is there anything there that would then maybe help offset that? If you could get that to us over the next month or so, that'd be helpful. Maybe there's not any, but maybe we could look.
Mr. Chairman, Representative Larson, yes, happy to get that to you. And we've had discussions up until this morning on that exact topic. We believe that with the school foundation program dollars that are in our standard budget, you all put them in there a couple of years ago as a restoration of one of those budget reductions that we would have made in step 3 reductions a couple of years ago. We have not, in the past several years, quote unquote, needed that school foundation program account because of the child count and the amount that we already had in the budget. But we do believe, we've had these discussions on the financial side with education, as I mentioned up until this morning, that a certain amount of this budget request could be reduced in kind by those SFP dollars that are in the Department of Health budget, especially for Part B, the 3 to 5 year olds, which is governed under the Federal Education Act. It's a little murkier, maybe a gray area for the birth to 2 year olds in Part C of if those dollars could be used to offset this request. But we're working on getting that information to this committee and the new members of the committee as soon as possible.
Thank you.
And you have that, what's that dollar amount?
Mr. Chairman, Mr. Co-Chair, we have approximately $4.3 million of SFP dollars in this budget unit from two years ago that you all appropriated. And it is
Representative Bear
ongoing.
was next then.
Thank you, Mr. Chairman. Director, I'm just curious, and I just need your explanation on this. It says in 23, we used the 2019 child count because of COVID impacts. Do we have a count for December of 23? I see in May of 24, we're at 3,762. So what was the child count?
Mr. Chairman, Representative Bear, I'll have to follow up after this meeting and get you that number. That came from our providers during that time requested, because there was so much disruption, maybe people not showing up in person, could we essentially float and use the previous year's child count to be able to budget and expend from the Department of Health for those services, which was approved. But I'll have to get you those numbers. I don't remember off the top of my head.
Follow-up?
Please.
Thank you, Mr. Chairman. Was there an account taken? Okay, thank you.
Mr. Chairman, Representative Bear, absolutely.
Okay. Anything else on this exception request? Anyone? All right, proceed.
Mr. Chairman, members of the committee, we're now on page 52, Unit 2512. It's the Wyoming Life Resource Center, and there's one exception request here.
Mr. Chairman, bottom of page 52, this is a special revenue request, no general fund, for $100,000 for our Life Resource Center, what we call our canteen fund. Many of you will remember, especially those who worked on our Life Resource Center and State Hospital facilities projects, we had closed down the Life Resource Center canteen years and years ago, primarily because we saw that a lot of the benefits of that canteen were going to staff and not clients, and a lot of our clients at the Life Resource Center at that time were not fed by traditional means, tube fed, et cetera. And so it was more of a staff utilization for that canteen than not. When the legislature enacted the new missions for the state hospital and the Life Resource Center, the new populations for the Life Resource Center to serve over in the months and years to come, I got a request from our administrator at that facility at the time to reopen the canteen specifically for client services. And with the types of clients from the state hospital, other high behavior clients that we have and will serve the Life Resource Center, the canteen can be used for employment coaching, skill building, cooking, and also service to to have a meal, have socialization, et cetera. So we have been operating in a very limited capacity for clients and their caretakers, the canteen at the Life Resource Center again, and typically support that with non-general fund means.
Anyone? Oh, Senator Guru.
Thank you, Mr. Chairman. So it is working. So you've opened it on a limited basis and you're having success, and that's why this request is there?
Mr. Chairman, Senator Guru, in general, yes, and I hate to sound nitpicky here with high performance standards, this is not a heavy utilized function of the Life Resource Center. We don't have staff and residents lined up around the block to use it. But I think it has generally been successful when our new goal of the Life Resource Center, especially with the new populations you all gave us, which there will be more of over time, we want folks to discharge to the community out of the Life Resource Center. And we're trying to use this as a mechanism for socialization, but also that employment coaching skill building there.
So just follow up. So just another piece to a bigger puzzle as far as giving them the tools they need to get back into society.
Mr. Chairman, that's accurate.
Thank you, Mr. Chairman.
Okay. Representative Bear.
Thank you, Mr. Chairman. Director, would you characterize this canteen expenditure as an emergency or an unexpected expenditure?
Mr. Chairman, Representative Bear, I wouldn't characterize it as emergency, unexpected. It's a good question. We have revenue from permanent land fund, et cetera, that supports certain elements of a facility like the Life Resource Center. I think given where we're going with the Life Resource Center, the populations we are trying to scale up there, both from the state hospital and otherwise, that this is a necessary expenditure to support. Would I categorize it as an emergency 100%? To be honest, no.
Anyone else? Hearing none, please proceed.
Mr. Chairman, this, I think we'll move on to page 59, but while we're on the previous request topic, because it's interrelated here, this request for the Life Resource Center canteen and the next handful that you'll see, which will conclude our presentation, and to Representative Bear's question, these are also B11 cleanups that we have done, and you all recall over the past several years, we've worked with the budget office on cleaning up routine B11s that, instead of doing that function every year, we put that funding into the standard budget.
Can't remind me of the page.
So now we're on page 57.
Mr. Chairman, so the remaining are all just increasing budget for, which we've done to really increase the transparency so that everybody knows what that is and we don't do it during the course of the interim?
Mr. Chairman, Representative Larson, yes. So with the canteen fund, with the requests that round us out from page 57 and on, this cleans up routine B11 spending authority that we would do as the executive branch and make it more transparent legislatively.
So clear through the rest of your exception requests are all just B11 conversions?
And Mr. Chairman, if you'll allow me, I'll just let Mr. McVicker describe the senior care B11 cleanups.
Yeah, Mr. Chairman, on page 57, we're now in the aging division. There's one exception request here in senior care, which is Unit 5002. This is, the next three are going to be in different areas of the aging division, and we have gotten more federal funds that are available to us. We just don't have the spending authority. So the way we've taken care of that in the past is to do B11s, process those so that we can get the spending authority for the federal funds. There's no general fund impact here. It really lessens the work on the department having to do the B11s, and also on Kevin's staff at the budget department having to process those B11s. So you'll see on page 57, it's $145,000, all federal funds, just based on grants that we've received in senior care that we don't have the spending authority for. Again, on page 59, it's exactly the same, except for it's in the nutritional services area. Federal grants have increased. This will eliminate B11s to the tune of $1.2 million. And lastly, on page 61, in the Title VII Elder Rights in the Aging Division, again, federal funds that we've received that we're trying to get the spending authority to, none of those will impact state general funds in any way. And we'll take any questions you have.
Mr. Chairman.
Questions?
If I may, very briefly, so all of those aging division requests that Eric just went over, that funding gets deployed to senior centers around the state. So that's not programming that we do directly. This is funding, in this case, federal funding that goes out to your local senior centers for those specific programs.
Questions, comments? Okay, anything generally as to the department? Senator Anderson.
Mr. Chairman, how are we doing with the skilled nursing facility for veterans at Buffalo? Do we have all three buildings open yet, or we still just have two?
Mr. Chairman, Senator Anderson, I'm really glad you asked. Something I was going to mention in some concluding remarks that we're really proud of. So the Veterans Home, we built and opened the new nursing home, the new skilled nursing facility in Buffalo about a year ago in December of 2023. And since then, especially over last summer, we've been fully VA surveyed and recognized from the Department of Veterans Affairs, and had our full survey for Medicare and Medicaid from CMS, and passed both. So we're fully certified, fully recognized by the VA just in the past several months. Accordingly, as you recall, we had kept our census at that facility lower, pending those licenses and certifications. So going into this past summer, we kept our census at about a third or a quarter, because there's some uncertainty there, and we want to see, do we get tagged? Do we have a plan of correction? Are we in compliance? The good news is that we've completed all of those surveys and gotten certified, gotten licensed, which is fantastic. So we're in the process of increasing our census. We're a little over half full right now at the nursing facility, and have plans in the coming weeks and months, now that we have those certifications, to increase the census there. In addition, the last step of that process, CMS has fully surveyed and certified us. We are still waiting on the federal government through their coordinator, which is called Noridian, to get our Medicare number. We still don't have that. It's the Byzantine bureaucracy takes a little while. We ask about it every week, and I think it'll be coming in short order.
God, how long could it take to give you a number?
I think, Mr. Chairman, I'm optimistic before the end of the year, but it could bleed into 2025. The good news on the tail end of that, just as a reminder to the committee, we designed the financial model of the new Veterans Nursing Home to, over time, not only break even, but cash flow positive for the general fund. Once we have our Medicare number, we can enroll the facility as a Medicaid provider, have a state cost-based rate for the Veterans Nursing Home combined with our VA per diem that we will receive at the Veterans Nursing Home, which will allow us to cash flow that facility positive. My target is in the next 18 months to achieve that. We'll report to this committee and others on how we're doing with that goal. I think it's lofty, but it's doable. And what that cash flow positive at the Veterans Home will allow us to do is to discount private pay rates to veterans who don't come into us on Medicaid, or we have that sort of general fund subsidy we would normally have. So it is really exciting, and I appreciate this committee earlier this year and many others who have visited the Veterans Home even in recent weeks to take a tour of both the domiciliary and the nursing home. Something we're really proud of, and got to commend the staff up there. If you've been through the new nursing facility, seen the model of care we're using, the layout, the physical environment, it's really nice to see, and something that I think was a vision of this body and the legislature. Go build this, do it in this way, and I've been really pleased with the results. We want to fill the third cottage. We have 3 cottages. We want to fill the third cottage in the next 6 months.
Senator Anderson.
Mr. Chairman, so do we have applicants for filling that third one? Isn't that about 12 veterans that would occupy that? So you do have 12 waiting to get in?
Mr. Chairman, Senator Anderson, we have more than 12, so we have a waiting list, which is a good thing, because there's demand for that facility, and for those of you who've seen it, it is very nice. So I'm not surprised by the demand that we have. But yes, once we open up those beds, once we have the appropriate staffing levels for Cottage 3, then we will fill based off of that waiting list.
Once Meridian gives you your Medicare number, can you back bill retroactively for the Medicare patients you have now?
Mr. Chairman, yes, there is a retroactive provision to the point where we were deemed in compliance on survey. So once we have that, both on the Medicare and Medicaid side, there's a retroactive provision.
Okay.
I want to be clear, though, it's not from the time that we opened in
Gotcha.
December,
You
but
got a dead loss in there somewhere.
from the time we were deemed compliant.
Okay. I would just touch on navigators a little bit. You and I had a conversation. I did sit in with a navigator as she attempted to call in to the phone for eligibility, and it was a mess. We spent an hour on it, and the web page likewise was not particularly helpful. And you said you'd have one of your people actually walk through that like they were an applicant and get it fixed. How are we coming on that?
Mr. Chairman, it's a good question. We struggle, and this is not an indication of poor performance in my mind. It's an indication of scale. Similar to our request for additional staff person and long-term care eligibility, we serve a lot of people in Medicaid, as I mentioned, between 60 and 80,000. We absolutely have room to improve on customer service, interface, online, et cetera. But we're not where certainly we want to be. I'll leave it at that, Mr. Chairman.
Can you hire it out as opposed to trying to get somebody in-house to do it? I would think there'd be easier to find expertise that's not in your bailiwick, that's not in your employ.
And Mr. Chairman, that is exactly what we do and kind of leads to the struggle. So as I mentioned with our customer service center, it is contracted out. That results in turnover of folks who need to be trained up in taking those calls, navigating through those applications, and it's a constant management issue with companies that we manage through contract to do that.
Well, do what you can, and I do want to commend at least the navigator that I'm familiar with. She's got incredible expertise and extraordinarily helpful. and she corrects all the bad advice that she gets from her friends, her neighbors, and sometimes even at the senior center. And so she's a big help to you. I think those people in the field are a huge help to you. All right, thank you.
Mr. Chairman.
John Bear, Representative Bear.
Thank you, Mr. Chairman. Director, I need a little bit of a history lesson. I wasn't part of the body when the 3 cottages were approved, and I know now we're looking at the home itself being replaced, and we're anticipating VA funds for that, but wondering whether we should go ahead and build it or not while we wait. Are these cottages, were they, is there some expectation of the VA providing funds for these, or has that already occurred?
Mr. Chairman, Representative Bear, yes, good question. So with the nursing cottages that have already been built, those were funded with 65% VA funds. So that is done and done. But to your point, the legislature will face another policy decision. I think we're on round 3 or 4 of this policy decision of reconstructing, rebuilding the domiciliary portion, the old soldiers and sailors home at the vet's home. And it's a tricky policy decision. We have an application into the VA for those 65% matching funds from the VA to do that project. Unfortunately, our priority level in the VA system is relatively low. Why wasn't it low for the nursing home was because we were the only state in the country that didn't have a veterans nursing home, so we entered that for that project very high on the priority list. We anticipate that the VA, the federal government, will at some point fund the 65% of the domiciliary reconstruction. We just don't know when. It really is an unknown there based on congressional appropriations and based on the other states and projects that are in that application system. So the policy decision has been for this body over the past 2 years, while we wait on the federal government to adjudicate that decision, should the state essentially front load that portion of the funding so that we can get started building the facility, ease against construction inflation, construction costs, those types of things. And last year, the State Building Commission approved and recommended that to the legislature. Ultimately, it was not decided to move in that direction. This year, I think you'll see the same recommendation, and I believe discussed tomorrow with state construction departments, capital construction requests. So it's, Representative Bear, it's tricky. I will say what I have said for many years. The recommendation to rebuild the domiciliary was made more than 10 years ago after condition assessment was done on all of the Department of Health facilities. The recommendation was do the state hospital first, followed by the Life Resource Center, and then the Veterans Home domiciliary. That's where we are with it, and I think the big policy decision for the legislature to make is should we invest those general funds up front, get the project done, and then wait what we think could be anywhere from 4 to 10 years based on what we've seen out of the federal government with these projects to get that reimbursement.
Follow on. And maybe offline, we can go, there's by domiciliary, that's assisted living as opposed to nursing home. Okay.
Right.
All right, wrap up.
Mr. Chairman, I won't belabor the points that other directors have made. Obviously have appreciated all of the things we've done with this committee over the years. Feels like a lot of what the legislature worked on, directed us to do for the past decade. A lot of those things came to fruition this year. Our behavioral health redesign launched, as I mentioned, on July 1st. I'm really optimistic and proud of the work that's going on there, both in terms of the staff that are working on that and our community behavioral health providers. I mentioned our WINGS technology project. I think in Medicaid, that's really paying dividends on what you all invested in and taking advantage of 90% federal match there, where we not only can provide better analysis, better reporting to you all, but as you directed us to do years ago, don't just make that system for Medicaid. Let's look at other benefits that technology system can realize. And so we've incorporated some of our public health programs into the WINGS technology enterprise. Our Title 25 system is, we do enrollment and eligibility and payment through WINGS. And now, probably the biggest one we've incorporated is the community mental health and substance abuse programs. That's around $100 million in the Department of Health budget. And that all of that programming, eligibility, claims processing, provider enrollment, et cetera, is now fully incorporated into that same technology system, giving us just far better efficiency, but also information and analytics to report to you all on populations that are shared across many different programs. And appreciate Senator Anderson bringing up the Veterans Nursing Home. Really proud of that effort and the facility staff up there. And one thing if you haven't noticed that I hope you'll notice going forward, between the State Hospital, the Life Resource Center, the Retirement Center in Basin, the Pioneer Home, and the Veterans Home, we're really making efforts to leverage those as one facility system because there's a lot of overlap with populations. And I'm really pleased to report, based on discussions we've had for 10 years, we have populations that were at the State Hospital, or formerly at the State Hospital, that are currently being served in the Retirement Center in Basin in a much less restrictive environment, and even at the Pioneer Home in Thermopolis, where we have a few former State Hospital clients that are thriving there in an open, unlocked setting that many of you asked and pushed us on over the years to really strike the right balance at those types of facilities. What's the balance between general access for people and the safety net role that we have? And I think there's more we can do there to leverage those facilities for this priority population while balancing the needs of the residents we have there. But the direction and the collaboration between those facilities and their clinical teams has been impressive. So
Can I just want to interject that I think that's due initially to the push from Representative Nicholas on those facilities that something had to change. And in fact, we had a meeting at one of them and there was an angry local crowd. And he just faced them down and said, well, the question is whether we should be maintaining a facility in one town that is to the benefit of that one community, or is it for the benefit of the whole state? And they put the rope away eventually. But I thought, wow, this guy's got some moxie. It was interesting encounter. So hats off to Representative Nicholas for pursuing that.
Thank you, Mr. Chairman. And last item that I'll mention, I know you've heard from the Chief Justice and the judiciary. The last 2 years has resulted in a very beneficial and maybe historic partnership between Department of Health and the judicial system when it comes to behavioral health. We have Title VII diversion programs up and running or almost up and running in some communities to get folks out of the judicial system that keep cycling through, out of the wait list at my state hospital. We have launched a telepsychiatry program for a few detention centers for their Title VII detainees who are waiting for admission to the state hospital, which has a wait list, to be able to provide direct care, medication support in the jail. I really appreciate partnership with some of the sheriffs that have joined us through those agreements, and the judicial and law enforcement system in general, recognizing with us that we keep seeing these populations over and over cycling through either on the judicial side or the psychiatric side with the state hospital. And it's nice to see that a lot of the finger pointing has stopped and we're trying some new things, maybe successful. We'll be able to report back on how much efficiency we see there and improvement to those folks' lives that we see. But it's been a good development between agencies like Health and DFS, Department of Corrections, the Supreme Court, judiciary, and law enforcement agencies to really see this as one population that we're trying to serve comprehensively. With that, Mr. Chairman, thank you for the time today, and happy to follow up with any of you offline with answers to questions you might have about our request.
Well, thanks to you and your team for all your work and all that you do. We appreciated your expertise and your professionalism over the years. And Merry Christmas.
Likewise, thank you.
All right, the schedule calls for a half-hour break. What's the pleasure of the group? 15 minutes? 15 minutes. Let's come back in at 10 till 4. Stand at ease.
Mr. Chairman, Chase will not be presenting. It will be Alex Horowitz from Pew, and he will be online.
Alex Horowitz?
Correct.
We are back from break, and our next agenda item is a presentation by the Pew Charitable Trust. And we welcome by Zoom Alex Horowitz. Alex, welcome. Welcome to Joint Appropriations Committee, State of Wyoming.
Great, thank you very much. Appreciate you having me out. And I can share some thoughts on our research at the Pew Charitable Trust. It's a nonprofit organization. I'm the director of housing policy, and we're doing work on the housing shortage broadly, the role of building codes, zoning codes, and the impact on housing supply and housing affordability. If it's all right, I will share some slides, and I've emailed this to committee staff so that everyone.
And Alex,
Yes.
if you can just speak up just a little bit louder, it'll carry a little bit better in this room. Thank you.
Okay, excellent, will do. Great, so I've got a couple slides, a few general thoughts on Wyoming and housing affordability and housing availability, and then I'll spend most of the time on single stair. So housing costs in the US have reached an all-time high in the past year, with half of renters spending more than 30% of income on rent. A quarter of renters spending more than 50% of income on rent in the US. US housing shortage estimated at 4 to 7 million homes. The shortage is the underlying cause of why housing costs have gotten so high. In the US at this point, 63% of households have one or two people in them, but only 23% of the housing stock is multifamily. So our housing stock ends up being a bit of a mismatch for our population, where there's a lot of desire to live closer to jobs, closer to commerce, and have shorter commutes and be able to do errands easily. In Wyoming, 67% of households have one or two people. That is an unusually high share, and only 13% of the housing stock is multifamily. That's an unusually low share relative to other states and the US as a whole. So Wyoming's housing inventory is down markedly from where it was. We're looking back to 2018, and there's a 39% drop overall in the number of homes available for sale in the state. That's a big drop. When we see inventory fall that much, prices usually rise quickly. And indeed, we see that in Wyoming, the median price is 49% above where it was in 2018, even breaking out 4 different metro areas in Wyoming. We see the same pattern in all 4 as statewide, with prices rising sharply since 2018 in the midst of the housing shortage. Rents tend to track home prices, and Wyoming is no exception. So the median rent is up 46% in the last 6 years in Wyoming, tracking with median home prices rising 49% during that time. Both of these are strong signs of a housing shortage, and we're seeing this happen the most in states that have the least inventory available to buy or to rent. The US broadly is short, especially on small apartment buildings, so buildings with 2 to 19 units. These are being built at a much lower rate than large apartment buildings with 50 plus units or than single family homes. So our stock of small apartment buildings has not kept up with demand or the overall housing stock. Why does that matter? Well, rents are the lowest in buildings with 2 to 19 units in the US. Rents are significantly lower than for either large high-rise buildings or for single family homes. So this has an impact on housing affordability, both by diminishing supply, but also by leaving out a lot of new construction of the lowest cost type of housing, apartment buildings with 2 to 19 units. Montana, recognizing this, they had the same experience, influx of residents, home prices rising rapidly, rents rising rapidly. And in 2023, with a goal of improving housing affordability in the state, availability, boosting economic growth, and conserving open space, avoiding sprawl, they passed 5 different strong bills. And those are the types of remedies that housing researchers across the ideological spectrum tend to support and see as likely to improve affordability by improving availability, getting more supply on the market, accessory dwelling units, duplexes, apartments in commercial areas, limiting parking requirements, simplifying permitting, and requiring jurisdictions to take some steps to make it easier to build homes. And so far, we're hearing from folks in state, a little bit too soon to see in the data, that more housing is coming online, and they're taking steps to deal with their housing shortage, adding more apartments in commercial areas, but also accessory dwelling units and duplexes, and permitting has sped up, according to
Alex?
folks in state. Yes.
The things you're citing, I think of as zoning. When you say building code, I thought you were talking about like the International Building Code, the International Fire Code. Here, you're just talking about changing zoning so you can put an accessory dwelling on a single-family lot. What are the actual building code issues that, or are you just using the terms interchangeably and without just using the terms loosely?
Great question. So committee staff had flagged there was interest in a few thoughts on general affordability before single stair, but actually that was the final slide before I jump on to the building code for the rest of the presentation.
Okay, I'll wait.
Okay, thank you. So single stair construction. Questions we're answering in new research, which we'll be publishing in about 2 months. So what are single stair buildings? How many are there? What are the cost impacts for builders and for residents? What do we know about fire safety? And what's causing those outcomes? So we've been researching this in 2024 and are preparing to publish research. So broadly, we're talking about buildings that have one staircase instead of requiring two. These are smaller buildings, and with one staircase, that means larger apartments can fit on either side because there's more flexibility in the layout. They don't have to be on just one side of the double-loaded corridor that separates the building to connect the two staircases. Because it's not just the two staircases that are required, but a corridor to connect the two staircases, so they can both be reached from every unit. Examples of single stair buildings, because they're smaller, they can fit on small lots. These are 3 pictures of single stair buildings in Seattle, a city that has allowed single stair construction since 1977. And you can see in all of these cases, a dual stair building with a corridor connecting them could not have fit on these lots. So dual stair buildings tend to be larger, bulkier, and they need larger lots. That means the builder needs to assemble multiple parcels or have a large unbuilt space. So these tend to fit in better with the surrounding neighborhood. By having one staircase, construction costs are lower. We estimate 6 to 13% lower based on estimates we've gotten from contractors, and that accounts for additional fire protection. 6 to 13% lower on construction costs can easily be the difference between a project penciling or not, and enabling lower rents and more housing to come online amidst the shortage. And also because the building itself is smaller and there's a little bit less work involved, that can accommodate a range of not just family sizes, but price points as well, at a time when a lot of the new housing coming online only reaches folks who are higher income, because as the building code has gotten more costly. An advantage is having more natural light and more ventilation. And this is part of the appeal of these buildings because you can have windows on multiple sides. But broadly, we're talking about buildings with smaller floor plates. So a dual stair building can be quite large. That means the units are much farther from the stairway on average, from either stairway, because the buildings themselves are larger. Sometimes this means that the building doesn't fit in as well in the neighborhood, but also purely from the perspective of egress, the units themselves are much farther from stairways in large dual stair buildings than in a single stair building. Single stair buildings are typically limited to 6 stories in height and no more than 4,000 square feet per floor or 4 units. Jurisdictions that allow them tend to limit them in size so that they are really a different animal than large dual stair buildings, and all units are close to the stairway for egress purposes. The reason why single stair buildings are not in the National Building Code in the US, but they do exist in most countries, is concerns about fire safety, and that multifamily housing is more dangerous than single-family housing from a fire safety perspective. In the US, 77% of homes are single-family, built under the single-family code, and they account for 83% of residential fire deaths. Multifamily homes in the US are 23% of the housing stock, but only 17% of the fire deaths. Overall, multifamily housing in the US has a lower fire death rate than single-family housing. But what about single-stair buildings specifically? Well, we looked at New York City, the city in the US that it does allow single-stair construction and it has the most single-stair buildings. We identified more than 4,400 single-stair buildings in New York City using their property tax records. There have been 3 fire deaths in single-stair buildings in New York City going back to 2012. That accounts for a fire death rate of 5 fire deaths per million resident years. Looking at all other buildings in New York City, they also have a fire death rate of 5 deaths per million resident years. So we see the same fire death rate in both building types. But there's a question, what about those 3 deaths in single-stair buildings? Were they related to only having 1 staircase? We can say definitively the answer is no. All 3 fire deaths occurred in unit and were not related to egress from the building. We have the fire reports from those fires. The fires themselves did not spread beyond the unit of origin. So we can say that there have been no fire deaths in New York City due to having 1 staircase in these more than 4,400 single-stair buildings, where we review data going back to 2012, because that's what's publicly available from the 2 large sources of fire deaths. We then looked at Seattle, the only other large city in the US that has had single-stair construction during this whole time period. There has been 1 fire death in a single-stair building in Seattle versus 41 in other buildings. And that fire death in a single-stair building in Seattle also occurred in unit. It was not related to egress out of the unit. It was not related to having 1 staircase. The fire itself did not spread beyond the unit of origin. The best international data is available from the Netherlands because they track fire deaths by building type in the Netherlands. Single-stair buildings have a lower rate of fire deaths relative to rescues than other building types in the Netherlands. We don't definitively know why this is, why they have a lower fire death rate. It may be also because the units are close to the stairway and they don't have long horizontal corridors in single-stair buildings, because horizontal corridors that are long are the primary way that smoke spreads in buildings, in multifamily buildings during fires. And that's what showed up in the research that they did in the Netherlands, testing the spread of smoke in different building types. But what about Wyoming? So Wyoming, we see that going back to the start of 2013, single-family housing has been 85% of the housing stock overall, but accounts for 90.5% of the fire deaths in Wyoming, going back to 2013. Old multifamily, built in 1999 or earlier, accounts for 10% of the housing stock in Wyoming and 7.9% of the fire deaths. New multifamily, built 2000 or later, we tend to use 2000 because this is when buildings became more modern in the US, often with fire-rated walls, sprinklers, features like self-closing doors, and non-combustible materials in stairways. And we see that new multifamily is 5% of the housing stock and 1.6% of the fire deaths. So new multifamily in Wyoming appears to be the safest housing type, and this strongly correlates with what we found in other states. We've done this analysis in Wyoming, Virginia, Delaware, and also Utah, which I'll show you. Utah had the same pattern as Wyoming and these other states, where we're seeing the exact same pattern across the board. The highest rate of fire deaths in single-family homes, a somewhat lower rate of fire deaths in old multifamily, and the new multifamily in Utah accounts for 9% of the housing stock, and there have been 0 fire deaths in new multifamily in Utah, consistent with the pattern in Wyoming and that we've seen in Virginia, Delaware, and other states. To wrap up with my final slide, single-stair buildings are safe, where we've been able to identify a fire death rate compared to other housing types. So the same as other multifamilies in New York City or better in the Netherlands. They do cost less. Not having a second staircase in a corridor shaves 6 to 13% off construction costs, enabling more projects to be economically viable. They do provide better ventilation and more natural light by having windows in multiple sizes and more family-sized units so that apartments aren't exclusively small. These are smaller buildings. They can fit on infill lots, revitalize main streets by going above stores or being on small lots where a dual stair building would be too bulky to fit. They use modern technology, sprinklers, fire-rated walls, non-combustible materials and stairways, self-closing doors. That replaces older, riskier buildings and may account for why modern multifamily has the strongest fire safety track record of any housing type. And lastly, there have been 0 fire deaths related to egress in single-stair buildings in New York City and Seattle, the 2 jurisdictions that have allowed single-stair construction during the whole time period that we reviewed. Thank you.
Mr. Chairman? Question.
Please.
Question.
Anderson.
You're talking about stairwells. You didn't mention the elevators or is there required to have elevators also? I realize the stairs are what you use when there's a fire, but do the buildings also have elevators in them?
Thank you. So, and through the chairman, this wouldn't be different than dual stair buildings. So this would not make any change to elevator requirements. You could either have an elevator in a single stair building or not have it. That's up to the building code and the builder, but it wouldn't be different than for dual stair buildings.
Okay. Don, you want to go ahead and distribute that? So what else can you tell us about the building code that is like this single stairwell? I mean, you know, cities aren't requiring double stairwells just because they feel like it. It's the International Building Code that requires it. And now we're cherry picking through there and repealing various, at least this one portion, which I'm all in favor of. I couldn't do it as a mayor in a small town. What else can you tell us is in the building code that's unnecessarily raising costs and really not affecting any real safety increase?
Sure, thank you. And I should flag that the US and Canada are the only 2 countries that have this requirement in their building code for 2 staircases once you get above 3 stories. Most high-income countries allow 5 to 8 stories for single stair buildings, and you don't need a second staircase until you get higher than that. But this is absolutely in the International Building Code, and the Egress Committee is examining this issue, and they already recommended allowing a 4th story on single stair buildings at their meeting last month. But also in the building code, 3 and 4 unit buildings are covered under the multifamily code, not the single family code. The multifamily code costs about 10% more to build under. And the main change is that even if a 3 or 4 unit building is small and is using fire safe materials, it still has to install sprinklers in those buildings.
Right.
Tennessee, North Carolina, and Connecticut have all taken action in the last 2 years to make a change there and allow 3 and 4 unit buildings to go under the single family code instead of the multifamily code. And that will reduce construction costs by about 10% for that housing and enable more 3 and 4 unit buildings to come online safely.
Okay, so there's 2. You got the double stairwell, you got the 3 to 4 multi-unit, doesn't have to have sprinklers. That's a big one. Sprinklers add 3 to 5% to the cost. So my question is, Pew, and I'm a big admirer of the work that you do. Do you have, I'm just going to tell you by way of background, and I'm sorry, anybody else wants to jump in, just throw something at me, but you know, we are required in Wyoming, I have a handout here for people. The State Fire Board is required to adopt the International Mechanical Code, International Building Code, International Fire Code, and then by statute, if the city accepts responsibility for inspections, they must adopt all those codes. They cannot adopt anything less, or they lose their right of delegation for the inspection. Now, what because I'm kind of ornery, you know, every once in a while those codes would come up and I'd just go ahead and not adopt something and it was just stupid, like mandatory sprinklers in 3 to 4 multifamily units. There's something in there that you can't have any road into a subdivision that exceeds like a 7% grade or something, which would have made every street on a hill in Sheridan illegal. But it's not the fault of the cities. It's this damn code, which is a political document. When you read the front page, it says, "Our thanks to the international manufacturers of fiberglass insulation and sprinklers manufacturers of America," and, you know, just all these people lobbying to get their products as mandatory in the code. Do you have a project to just call out what really is unnecessary in this code for safety? You've cited 2 big ones, the sprinklers and these mandatory double stairwells. What else is Pew working on? Do you have a list of these things? Because the only way we can get rid of them, the only way a city or a town can get out from underneath them is if the legislature acts.
Thank you. We're doing more research on this area. Those are the 2 we've got so far, but they're meaningful ones, that they would substantially reduce the cost of multifamily construction for small multifamily buildings.
Okay. We've got a draft statute here on the double stairwell. Did I assume that came from you? I don't know. Do we have a draft on getting rid of mandatory sprinklers in multifamilies of 4 or less? How do we come about this particular draft?
Mr. Chairman, I believe.
Oh, the regulatory committee? Okay, Clark, go ahead.
Yes, just what the co-chairman said. The Regulatory Reduction Task Force suggested the LSO Draft 250 on multifamily dwelling single stairwell exits. That's a recommendation out of the task force.
Okay.
But we didn't, but there are other ideas that were percolating through the task force that didn't make it to prime time. But for example, minimum lot sizes, I think, right? If you have large minimum lot sizes, that tends to drive up prices for housing, et cetera.
Yeah.
And the building code strongly support what you've just said. Wish I were here to help lead the charge, to
Well,
be part of
me
the charge.
too, but, you know, is the work of the regulatory task force going to be ongoing? Waiting to see? Okay, well, I would urge the new regime to continue with it because it's pretty damn important. These things really raise building costs, and as you can tell, I was frustrated by 10 years of trying to deal with the building code, and every time I found something stupid, they'd say, well, we can't change it, or the fire marshal will take away our ability to do the inspections. And then you check the statute and find out they're right. And it's just very little, we're just kind of, unless the legislature does something with those codes, we're kind of stuck.
We tried to put you on the committee.
Yeah, I do remember. I just get so mad all over again, though. You wouldn't have wanted me on there. I couldn't have kept my temper in check. All right, Pew Charitable Trust. What else what questions do we have for Alex? Comments from the group?
Mr. Chairman.
Yes. Representative Zwanitzer.
Thank you, Mr. Chairman. Alex, I wanted to make sure I understood the slides that you had up. And your slides timeframe was from 2012 to 2022, and it suggested that there was very few fires in the single staircase apartments. And then it contrasted that with all other buildings or all other residential units. But all those other residential units, were they also built between 2012 and 2022? Because if you're comparing them with all the, the homes in a residential area, then obviously the statistics are going to be skewed.
Thank you. And through the chair, so we looked at buildings, we looked at fire deaths going from 2012, November 2012 through March of 2024 is the data set that we had available to analyze. But the buildings themselves could have been built long before that. So we were not looking at year of construction. We were looking at all buildings available, and we categorized all 468 fire deaths in New York City during that time period and identified 3 in single stair buildings, 465 in other buildings, and that came out to the same rate of fire deaths of 5 per million, but none of the 3 were due to the lack of a second staircase. So the year of construction is not a factor here in that New York City analysis, but overall, newly built multifamily over the exact same time period has a dramatically lower rate of fire death because of the fire protection measures in place.
Follow up? Okay. Anything else for Alex before we cut him loose? All right. Well, Mr. Horowitz, thank you very much.
Thank you very much.
Greatly
Appreciate it.
appreciate the work of the Pew group, and I hope we have a regulatory task force going forward that continues the great work with your organization.
Thank you very much.
Let's see, zoning protest petition amendments and multifamily dwelling single stairwell exists.
Exits.
It says exists.
I know it does. It's spelled wrong 2 or 3 times in our information. 2 or 3 times.
We've never misspelled anything.
No.
Hey, welcome. It's good to see you both. Fire away, Dave.
Thank you, Mr. Chairman. David Hopkins with the Legislative Service Office. I am here to discuss the multifamily dwelling single stairwell exits draft, and Talise Hansen is with the other one. Did you have a preference on which one you wanted to take up first?
Let's do the stairwell.
That does make some sense,
Stairwell,
given
all right.
the top of the conversations. So, Mr. Chairman, as was mentioned, this bill does come to the committee from the Regulatory Reduction Task Force at its October meeting. The committee did vote to sponsor, or rather to send this bill and move it forward, and then it is now here before you. The couple of other things with just background, as has been discussed a little bit already, but generally speaking, the codes for, particularly with multifamily housing and that sort of thing is many of the municipalities, local governments simply adopt kind of the broad international codes, particularly the International Building Code, which does prohibit that multi-stair or single stairwells above 3 stories. So what this draft then does on page 2, in subsection A, it simply provides that, except as otherwise provided in subsection B, which we'll get to, that notwithstanding any other law to the contrary, no state agency, county, city, or town shall require more than one exit to serve 6 or fewer stories of a residential group R2 occupancy. And that language, the residential group R2 occupancy, does come from the International Building Code. That definition you see there next on those further lines is simply a residential occupancy containing sleeping units of more than 2 dwelling units, where the occupants are primarily permanent in nature, including apartment houses, boarding houses, convents, dormitories, and work units. So it provides initially kind of a across-the-board ban on state agencies, local governments from prohibiting single stairwells in those R2 occupancies. But B provides an exception here that the county, city, or town may adopt an ordinance or resolution requiring more than one exit to 6 or fewer stories of residential group R2 occupancies in the same building, provided that the adoption of a uniform code, such as the International Building Code, shall not be deemed to prohibit one exit unless, in addition to adopting the uniform code, the ordinance or resolution expressly requires more than one exit to serve 6 or fewer stories of a residential group R2 occupancy. So that subsection primarily gives that authority back to the county, cities, or towns. If they want to prohibit that, they can, but they can't prohibit it simply by a broad adoption of a code. They have to expressly spell out that they are prohibiting single stairwell buildings. The act would be effective July 1st, 2025, and I'd stand for any questions on the draft.
So, if I may, on B, Just the fact that the city has to adopt the IBC every year won't be deemed to override this. They have to adopt a specific ordinance that says we want 2 stairwells in every multifamily building.
Exactly.
Okay.
Where did this draft come from?
Again, Mr. Chairman, it ultimately came out of the Regulatory Reduction Task Force. It was brought to the task force by some of the members of the task force.
Yeah, the draft came from which state?
The draft is original.
All right, the rest of the states can copy us. All right,
Yes, we are.
what's next? Public testimony? Yes,
Mr. Chairman,
Representative Stith.
for Mr. Hopkinson, was there any discussion or consideration of restricting the width of these buildings that have a single stairwell?
The width of the what?
Of the buildings that have the single stairwell. We heard the Pew Charitable Trust representative just describe how this single stairwell construction works really well for essentially smaller buildings. But if it's, 200 feet wide, if the building is 200 feet long and only has a single stairwell, it sounded like there might be additional fire considerations.
Okay.
Mr. Chairman, this draft does not go or otherwise affect, the sprinkler requirements, size requirements, or anything like that that a local government may impose or that the IBC may impose. I don't recall there being, there wasn't a request to include those within the draft when it was initially drafted. I do recall maybe there was some discussion at the meetings about the sprinklers issues, but nothing was asked to be included in this draft.
Representative Stith, are you concerned?
Mr. Chairman, I really appreciated the representative from the Pew Charitable Trust talking about how the fire safety record is really good for these single stairwell buildings. But just visually, if you look at it, if you thought to yourself, if you had a building that were really, really wide, like 200, like a big building that only had 1 stairwell, then you can imagine a scenario where the safety record wouldn't look as nice. So just public safety concern, that's all.
Yeah, except they've got to be sprinklered and the fireproofing standards up. But go ahead, David Swanitzer, Representative Swanitzer.
Thank you, Mr. Chairman. Was there any discussion about having the proper fire equipment, that the city or the county had the proper fire equipment for a 6-story building? Or was the testimony that whatever fire suppression they have in the building is sufficient to where they don't need a ladder truck to, pull somebody out of the 5th story? Was there any, I don't see anybody from the fire department here, so that's why I'm just kind of curious. And I know that Alex mentioned something about fire suppression, but, you get somebody stuck up on the upper floors. If your city or county doesn't have the equipment to rescue those folks, does that need to be a consideration, or was it discussed in the regulatory committee?
I don't know. I don't know if the second stairwell is going to impact whether or not the county, whether the city gets a ladder truck for the highest. Well, go ahead, David, I'm sorry.
Well, Mr. Chairman, if you have 2 exits, that could be an excuse not to have a fire truck, right? Because you're saying, hey, you can't get out the front door, you get out the back door. But if you have that fire burning at the front door of the only exit in the building, then I have some concerns. And if there's any discussion, apparently there's somebody
Okay,
online.
Mike Yin.
Thank you.
Committee, Mr. Chairman, thank you. So 2 things. I'm mostly here to answer questions, so happy to answer those questions that have been presented already. For buildings that are very wide, as Representative Stith mentioned, you still get better layouts with the single staircase requirement. So you wouldn't necessarily have a single staircase for the entire building, but you could have multiple staircases that go to specific units. So that way you still no longer require that hallway that kind of cuts across and lets smoke feed across the entire floor. You could have 4 units to 1 staircase for a set of 20 units long where each 4 units, you have 5 different staircases, but you still get a better, more dense layout than you would necessarily with the multiple staircase requirement, where you have this long hallway that cuts a building basically in half and restricts the type of layout. And that also is still safer, right, than that multi-staircase requirement, because you have staircases that are closer to the units rather than staircases that may be a very long hallway away. And with regards to the fire truck issue, if a locality isn't comfortable with their fire suppression efforts from a local fire district, they can always put in an ordinance to require multiple staircases if they feel that it's unsafe in any way. But again, I think that, as the data showed, the multifamily units, new fire safety building codes make a lot of that really not necessary, because in the 3 cases where there were fires, the fire never left the unit. So units have things like self-closing doors and fire-resistant materials, and that really prevents spread of a fire from a unit to another unit.
Does that address your concern? It would be nice to have the state fire marshal here. I've been through this enough times that sometimes what you hear is you can't put a price on safety. And
So, Mr. Co-Chair, we talked about these various issues during the committee. And had the same go around in these discussions, and the fire marshal was present and was available to testify about them. There's no question that if you have a super long hallway and the fire stairway in the middle, we had the diagrams up, we talked about them. Ultimately, we came to the consensus that, yeah, in the biggest picture of things, it's still equally as safe as having 2.
Okay. Further discussion before we go to public comment? Thanks, Representative Yin. All right, open up for public comment. Welcome. Thank you. Yep, turn the mic on and pull it close.
There we go. Thank you. My name is Jim Manley. I am the Director of State Legal Policy for Pacific Legal Foundation. I'm here primarily to speak on the next bill that you're going to consider. That's really our area of expertise as a national nonprofit law firm. But I just wanted to frame the discussion. As Alex Horowitz explained, the housing crisis is a supply problem. And we at Pacific Legal Foundation have developed a number of model policies to help address that supply problem. One of them is consistent with the second bill you'll consider. But this bill also, I think, is consistent with addressing that supply problem and bringing more housing online. And I have tremendous respect for the work that Alex and his colleagues at Pew have done on this issue, and PLF is also supportive of this bill. We don't have a lot to add from a technical perspective, but from a policy perspective, we think it's good policy. So I'll leave it at that, and happy to answer any questions.
Okay. Questions for Mr. Manley? I'm curious, does your organization have an effort, as I was alluding to with Pew, to review these building codes and identify things that add cost with little or only minor incremental additions to safety?
Well, Mr. Chairman, the short answer is no. We've focused more on building permit process, which I'd be happy to talk about. But I actually did add that to my to-do list. So maybe next year we'll talk about that.
Okay. All right, anything for Mr. Manley before we go back to the bill? All right, stay right where you are because we're going to be coming up. All right, close public comment, back to the committee. Oh, I'm sorry, I did not see you. Come on up. Welcome, state your name for the record, and the floor is yours.
You'd think I'd never been here before. My name is Richard Garrett. I live here in Cheyenne, and I'm speaking on behalf of a condominium association of which I'm a member here in town, the Park Lane Condominium. Our building is a 17-unit building, including a manager's apartment, 5 stories. It was built in the 1960s. It is a building that is constructed primarily of concrete and block. It's highly fire resistant and certainly conformed to all applicable codes at the time of construction. Its construction very closely mirrors the construction techniques that Pew Charitable shared with us about a central staircase kind of building, except in our case, there are 2 staircases in that central area. So there's a level of redundancy that was apparently required at the time, but is, I think, probably outdated in terms of today's needs. Our building, in addition to being fire resistant, also has a certain amount of sprinkling systems in it, fire suppression systems. We've got fire detection systems, self-closing doors. We conform with building code in terms of no blockages in the stairwells. And it's those stairwells that I want to talk to you specifically about as a real-world example. I think to preface, though, this body always takes life safety issues very, very seriously, and I appreciate that very much. But I think in this particular case that I'm going to provide to you, our safety in our particular building is not compromised and would not be compromised in buildings that were constructed in a similar fashion. Our 2 stairwells are no more than 10 feet from one another, the entrances to them on each floor. In turn, the residents' access to those stairwells is no more than 10 feet either. So we have a high degree of redundancy. At the same time, with the 1960s building, we're faced with a lot of maintenance issues, all of which I'm sure you can imagine, one of which is an HVAC system that is somewhat out of date. And we have received estimates on the cost of repairing and replacing that system north of $500,000. We imagine that if this bill was to pass as drafted and to be adopted by municipalities, and specifically Cheyenne, that we might be able to find an alternative way to update our HVAC system using the existing stairwell at a more economical cost without sacrificing life safety goals. So that's the real world example that I can provide. I think it's all a matter of trying to achieve primarily 2 goals here. One is ensuring life safety, and the other is to try to find ways to build more creatively, build up rather than out, and provide more affordable housing. If we can reduce incremental costs for building by 6 to 13%, as Pew has suggested, that's significant to a developer. So certainly eager to answer any questions. I invite you all to come over to our place tonight, and I'll show you exactly what I'm talking about. And I thank you for your time. Thank you. Okay.
Good afternoon. My name is Dan Dorsch, and thank you for your time, Mr. Chairman, members of the committee. Speaking to you from a perspective of having served on the Cheyenne Affordable Housing Task Force for the last 3.5 years, and I currently serve as the chair of that task force, we started with the same perspective as well, safety, the balance of safety and affordability, right? Not sacrificing one for the other. When it comes to this bill, I would support this bill. Hopefully it will move forward to have conversation next year. And what I want to point out to you is, here in Cheyenne, what we've done is we've done some eliminations to restrictions for the UDC locally. We eliminated density maximums on multifamily units. We eliminated single lot minimums on single family homes and developments. We reduced parking requirements from 1.5 to 1 unit per door for studio and single door apartments. And I think this elimination, or the allowance of single story for this height goes in play with those UDC changes. And to Mr. Manley and the gentleman from the Pew Charitable Foundation's point of adding supply, this allows creative ways to use infill lots that are less costly to develop than new subdivisions, because you're building up, building out, like Mr. Garrett said. So allowing this bill to move forward would help developers and builders find creative ways to utilize unused vacant lots within city limits already surrounded by city infrastructure, which is much less costly than creating new subdivisions further from the city center. And it allows for local control. So it allows the municipalities to decide whether or not they would like to adapt these changes. Thank you for your time, and I stand for any questions.
David, the situation that Rich describes, now, I read yours with what I had in mind was new construction. Now he's talking about an existing building where they want to utilize the second stairwell. Is this going to be, will this apply to existing buildings? His situation, if it passes the legislature?
Mr. Chairman, the way I read it, I don't see why it wouldn't. I don't think it would ultimately be up to that local community and their specific requirements. But if they don't specifically exclude those stairwells, as long as it meets all of the other building code requirements that may be in place, then I think this would apply.
So his contractor goes down to City Hall to pull a building permit, then it shows that they're using that second stairwell. They can't object to the building permit on the basis of that, because they would in effect be requiring the second stairwell. That's the way you read it?
Yes, Mr. Chairman.
Okay. All right. Thank you. All right. Any further public testimony? Hearing none, I'll close public testimony. It's to the committee. Moved in second in discussion. Hearing none, call the roll.
Members of the committee, the motion is on 25 LSO 0250, working draft 0.5. Representative Henderson.
Aye.
Representative Larson. Representative Sherwood.
Aye.
Representative Stith.
Aye.
Representative Walters. Representative Zwanenser Dave.
No.
Senator Anderson. Senator Garou.
Aye.
Senator Nethercott. Senator Salazar. Co-Chairman Nicholas. Chairman Kinski.
Aye.
Mr. Chairman, the motion is agreed to. House bill or Senate file?
House file? All right. All right, next up is, we've got Mr. Hopkinson. Oh, it's not Mr. Hopkinson, okay. Let me find that bit of paper here. All right, floor is yours.
Mr. Chairman, members of the committee, Talise Hansen, Staff Attorney LSO, presenting Bill Draft 25 LSO 85, version 0.5, zoning protest petition amendments. So this bill draft was also considered and worked this interim by the Regulatory Reduction Task Force. The task
Mr. Chairman?
force.
Yes.
Mr. Chairman, could you say your name one more time? I missed it.
Talise Hansen.
Julie Hansen?
Talise.
Talise. Talise, just like it is on her door.
Oh.
Mr. Chairman, this bill draft was considered by the Regulatory Reduction Task Force, and it was forwarded out of the task force at its October meeting. This bill draft amends the statute that governs zoning protest petitions within cities and towns in Wyoming. The current law requires a zoning protest petition to be signed by 20% of the property owners of the area of lots included in the proposed zoning change or property owners immediately adjacent to the proposed zoning change within 140 feet. In order for a proposed zoning change to become effective after a zoning protest petition has been signed by 20% of the eligible property owners, the current statute requires approval by 3/4 of all the members of the governing body of the city or town. So walking through the bill draft, section 1 on page 1, line 7 amends the statute that I've been discussing dealing with zoning protest petitions. Page 2, lines 1 and 2 adds the language, who can demonstrate a concrete and particularized harm. This language adds another requirement for an owner to be eligible to sign a zoning protest petition under the statute. The owners must demonstrate a concrete and particularized harm. This is part of the legal standard used for a person to show that they have standing to bring a lawsuit in federal court. Page 2, lines 2 and 3 strikes 20% of the property owners required to sign a zoning protest petition and inserts 50%. Page 2, line 4 is a conforming change, strikes of those and inserting the owners. Page 2, lines 5 and 6 strikes 140 feet and inserts 500 feet. This change expands the scope of the eligible property owners who can sign a zoning protest petition from those who own the area of lots immediately adjacent to the proposed zoning change within 140 feet to 500 feet. Page 2, lines 7 and 8 strikes the requirement of an affirmative vote of 3/4 of all the members of the governing body for proposed zoning change to become effective and replaces it with a majority of all the members of the governing body. Page 2, line 9 is a conforming change. And section 2 on page 2, lines 13 and 14 provides that this act shall apply to protests filed on and after July 1st, 2025. And section 3 provides an effective date of July 1st, 2025. And I'll stand for any questions.
Questions? My question is, on page 2, I'm starting on line 1, the owners who can demonstrate a concrete and particularized harm and who own 50% or more of the area of the lots, including the proposed change, that's clear, comma, or the owners immediately adjacent within a distance of 500 feet. Do the owners within 500 feet have to show particularized harm, or are they excluded from that requirement? Because it looks to me like they don't have to show particularized harm. What did you intend there?
Mr. Chairman, the intent of the task force was to have the who can demonstrate concrete and particularized harm to apply to both the owner of the area of the lots included in the proposed change and those within 500 feet.
Mr. Chairman.
Representative Stith, am I reading it wrong?
I think the word "and" on line 2 fixes it so that the entire universe of people who can protest are those who demonstrate a concrete and particularized harm and who either own 50% of the area of the lots, including the proposed change, or immediately adjacent.
You don't have either. It says "and who own." Do you want to put either in there?
No, you want, I think, my understanding of the intent is you want to only let people who can demonstrate a concrete and particularized harm file a protest, not just people who would prefer there to be a park or a vacant lot instead of being a subdivision.
Right.
So I think the current draft accomplishes that.
Okay. Representative Larson.
Thank you. Talise, what do you do on properties that have multiple owners? Do they all, and there's conflicts within those owners on if there's a problem or not? Am I making any sense? So you could have a property, you could have one owner that are in this, they're in the protest, but how do, if it's me and Bob that own it, and Bob says I don't like it, and I says, there's no problem with it, then Bob gets to participate, and then I feel that how does that work?
Mr. Chairman, Representative Larson, I'm honestly not sure how it works practically.
Is that something the task force talked about? Is it even anything that's a concern? Am I just making up a problem?
Yeah, the husband wants to protest and the wife doesn't, and they're both on the deed.
So I think the answer is we didn't have an answer to that. It was a common sense answer, that you
Which
get one
one?
vote from one owner. And if it's multiple owners, then they have to figure out what that one vote's gonna be.
Or they both vote and cancel each other out, yes and no.
Okay, thank you. Just curious.
You're right, it happens though. Okay? Please, Representative Walters.
Thank you, Mr. Chairman. To anyone, whether Talise or someone that was on the task force, what is a concrete harm or a particularized harm versus just a harm?
Well, Mr. Manley answered that. Go ahead.
Mr. Chairman, Representative Walters, concrete and particularized harm is sort of a legal term of art that means a harm that's specific to you, that isn't a harm that's shared by everyone in the community. So you, as the owner making the protest, would be hurt in a unique way that isn't shared by everybody, every other Wyoming in. Does that help clarify?
Mr. Chairman, yes, it does. So it is a legal term of art. It's not just an enhancement of the harm.
Mr. Chairman, Representative Walters, it's a legal term of art. It's very common, as Talise mentioned, in the federal standing context to determine who is injured to the sufficient extent that they can bring a lawsuit in federal court. So it's a well-known standard.
I've got a question for Talise or for members of the task force. What's the rationale for extending the distance from 140 to 500 feet and reducing the requirement for the override by the governing body from 3/4 to a majority?
Mr. Chairman, the task force received information in a form of memo on what other states' zoning protest petition statutes look like. Currently, there's 22 states, including Wyoming, that have a zoning protest petition statute. And the specific distances from those various states range from anywhere from 100 feet to 1,000 feet. And Wyoming is 140 feet, so they're on the lower end compared to some of the other states. So the task force made a motion to move it to 500
I
feet.
think part of that, Talise, also is we did an average lot size in all the communities. And it was the lot sizes in Wyoming are a lot bigger on average on city blocks than most other.
I see, so 140 could be 3 property owners.
Yeah.
And why did they change from 3/4 to a majority on the governing body to override them?
Mr. Chairman, that was also a policy choice by the task force, but most states, including Wyoming, require 20%. Montana requires 25%, Missouri 30%, South Dakota 40%, and Massachusetts is the only one that requires 50% or
Okay.
more.
All right. Anything else for Talise before we open it up for public comment?
No.
All right, public comment. Mr. Manley, welcome.
Thank you, Mr. Chairman.
Just to follow up on your question, though. The problem was if you have only 20% and you've got, all you need is one landowner if you only have 4 landowners around you. So we just want to make it a little more strenuous to be able to go in and interrupt someone's variance. So it's not so easy to do.
Oh, I'm with you all the way. With you all the way. Okay.
Thank you. As I said, I'm Jim Manley. I direct state legal policy for Pacific Legal Foundation. PLF is a national nonprofit law firm. It was founded 50 years ago by members of Governor Reagan's staff, which is how we ended up in California, of all places. We are a law firm first, so we have around 100 attorneys who litigate issues in property rights, separation of powers, and equality and economic opportunity issues. We also have a state legal policy team and a federal legal policy team. And we're using all those capabilities to look at the housing crisis. We all acknowledge there's a crisis. We don't need to belabor that. And when we've looked at this from a policy perspective, what we want to do is we look at it from a property rights perspective. And we have tried to craft policies that both maintain local control, but expand the supply of affordable housing. And so one of the ways that we do that is by removing delays. Delays cost money, delays kill projects, delays make houses more expensive. Our research shows that a delay of as little as 6 months can add $30,000 to the cost of a house. And that's just in one anecdotal study. There's data across the country that shows that the longer a delay, the higher the cost of housing. And what this bill would do is reduce some of that delay. This comes at the end of a very long process where there's lots of public input. And what this prevents is outsiders coming in at the last minute and appending a local decision about a rezoning. What our research shows is that those folks who are raising objections are most often not the people that are going to benefit. The first-time home buyers are going to benefit from an expansion in the housing stock. They're going to benefit the most. So we see this bill, it's similar to a bill that we've suggested as part of a suite of bills to streamline the development process, and we support it wholeheartedly. I think I'm happy to discuss any of the other questions about how to read it, but I think Representative Stith had it right on the and/or question. And on the multiple owners question, this bill doesn't actually change the fundamental way that this works. That it already is the case that owners of certain properties can object to zoning decisions. This just changes the criteria for which owners can object, but doesn't change that question of multiple owners. Currently, that's an issue that is dealt with. I don't actually know the answer to it. I think, Mr. Chairman, you had it right that if there are two votes and they're opposed, they just cancel each other out.
Questions for Mr. Manley? I'm looking at your organization's webpage. You have a lot of Supreme Court action there. Have you been able to argue in front of the Supreme Court?
Thank you, Mr. Chairman. We've argued 18 cases in front of the Supreme Court. 17 of them have to do with the right to own and use property. We won 2 terms ago 3 cases at the court in one term, which is pretty unprecedented, or close to unprecedented, I should say. One case involved the Clean Water Act and the federal government's authority under that law. The other case involved home equity theft, where the government collects a property tax debt and takes not just what's owed, but the entire property. And then the last case involved the statute of limitations under the Quiet Title Act. And I was on that boring third case. But I have...
Now, were you the guy with the brief, or were you arguing?
My colleague argued the case.
Okay.
I helped draft the briefs and helped him prepare.
Well, you'll be next up. All right, thank you.
Thank you, Mr. Chairman, members of the committee. Dan Dorsch, speaking to you this time on behalf of the Southeast Wyoming Builders Association. The Southeast, or SUBA, one of my favorite acronyms to say. SUBA is a membership organization made up of home builders and other contractors, lenders, and others related to the home building business. We support this bill mainly because to Mr. Manley's point, it delays add costs. Last year, there was a SUBA member who tried to get an apartment complex put on 10 acres of vacant, blighted property and turned it into much-needed housing apartments. And it was stopped by the zoning protest petition. And specifically, it lost because of the supermajority rule. It lost here in Cheyenne 7-3, which with a regular vote would have passed. So we stand in support of this bill, and thank you for your time.
All right, thank you again. Questions for this gentleman? No? All right. What about Bob?
Mr. Chairman, I'm Bob McLaurin with WAM. we support this bill. We think it reinforces local decision-making, and we appreciate you bringing it forward.
You get an award for that.
Mr. Chairman, I'm the only thing between you and the cocktail hour, so I wanted to be brief.
Bill's been moved and seconded. Discussion?
Mr. Chairman.
Representative Stith.
Mr. Chairman, having reflected upon your comments, I think we might add just a couple of words to make the intent clear. And I would move that on page 2, line 2, after the phrase particularized harm and who, add the word either on line 2. And then on line 4, after the word change, delete the comma. Then after the word or, add comprise 50% of the, so that as amended, it would read owners who can demonstrate a concrete and particularized harm and who either own 50% or more of the area of the lots included in the proposed change or comprise 50% of the owners, 50% or more of the owners immediately adjacent. I think that would make it less subject to challenge.
Second.
Bob's doing the Yoda Zen thing. He's thinking about it. What are you coming up with, legal Zen master?
That makes it all that much clearer.
Mr. Chairman, if I can explain the reasoning behind that, as I reflected on Chairman Kinski's comments, what bothers me is the comma in the current draft on line 4. Because with the comma that is after the phrase proposed change, some lawyer with a motive to do so could argue that the first phrase, owners who can demonstrate a particularized harm and who own 50% of the area of the lots included in the proposed change, is one class, and the second class of people who can object are the owners immediately adjacent. And so you'd have this weird situation where owners immediately adjacent wouldn't have to show a concrete and particularized harm, which of course is the opposite of what we intend. So I think it cleans it up to have the either before own on line 2, and then have the somewhat wordy phrase comprise 50% or more of the owners added on line 4, and delete the comma after the word change.
Okay, did we have a second on it? Finish the discussion. All those in favor of the amendment as proposed signify by saying aye.
Aye.
Opposed, same sign. Motion.
No.
You're a no, all right. Back on the bill. Question, call the roll.
The motion is on 25 LSO 0085, working draft 0.5. Representative Henderson.
Aye.
As amended.
Aye.
Representative Larson. Aye. Representative Sherwood.
Aye.
Representative Stith.
Aye.
Representative Walters. Aye. Representative Swan and Sir Dave.
Aye.
Senator Anderson.
Aye.
Senator Guru.
Aye.
Senator Nethercott. Aye. Senator Salazar.
Aye.
Co-Chairman Nicholas. Chairman Kinski.
Aye.
Mr. Chairman, the motion is agreed to. House or Senate?
Senate. Senate bill. Okay. That finishes the work for the day. Don, what do you have for us?
Well, Mr. Chairman, tomorrow's topics are largely related to capital construction of one form or another. You begin with a discussion from the Select Committee or Task Force on Select Subcommittee on Capital Interpretive Exhibits and Wayfinding, followed by item number 43 at 8:30 a.m., which is the state construction. Item number 45 rounds out the morning and that relates to K-12. Excuse me, I've reversed those. Item number 43 is K-12 construction. Item number 45 is state construction. In the afternoon, Secretary of State Gray will be presenting his exception request, followed by a discussion from the Wyoming State Shooting Complex Oversight Task Force. Rounding out the day is a discussion of the LaPrelle Dam. If you wanted to, and if you maintain the pace that you did today, which was, an hour or two quicker than originally planned, we could move the two agencies which you have requested to call in, the Wyoming Business Council and the Department of Workforce Services, both of whom have indicated they are available tomorrow afternoon. We could move them to Thursday afternoon.
Yeah, I'd like to bring them in.
We're also open to any additional callbacks. And we've also, just for the benefit of the public who may be listening in, we have both an online form and a physical form. I don't believe we have any individuals who have signed up yet for public comment, but are certainly available to do so over the next day.
All right. We'll pick up again 8 a.m. tomorrow with the Capitol interpretive exhibits. Anything, Mr. Co-Chair? All right, we stand adjourned.